Good morning and namaste to one and all, our in person and virtual audience. It gives me immense pleasure to extend a very warm welcome to you all on behalf of Udyan Care and our partners. My name is Srishti and I am a psychologist working as a counselor since 1 year. मैं काउंसलर सृष्टि आप सभी का उद्यन केयर की तरफ से स्वागत करती हूँ. Today is a day packed with full day action. We have the fit deliberations till lunch, followed by our academic journal and panel discussion post lunch. We feel grateful to our speakers and our honorable guests for their presence in today's event. At Udyan Care, we believe in learning and collaborating to build strong partnerships. So with this spirit, we earnestly request you all to stay with till the end of the day. We hope that by end of the day, we are able to create a platform for exchanging learnings and seeking inputs from our esteemed guests. हम आशा करते हैं कि आज के अंत तक हम अपने महत्वपूर्ण मेहमानों से अपने काम पर सीखने और सलाह लेने के लिए एक मंच तैयार कर सकेंगे. I will call upon my co-anchor to please take this forward.
Good morning, everyone. My name is Raja, and I am a care experiencing person. I have spent most of my childhood in OCCI in Delhi, and here I am today, working as a community outreach worker in FIT project of Udyan Care. It's been a year. I'm finding my purpose in life, trying to work with children, family, communities, and trying to keep children in the family and away from institution. नमस्ते, मैं राजा हूँ और मैं एक सीसीआई में रह चुका हूँ और मैंने अपने बचपन का ज़्यादातर समय सीसीआई में बिताया है और मैं अभी फिट प्रोजेक्ट में एक आउटरीच वर्कर के तौर पर काम करता हूँ और मैं परिवार और बच्चों को मजबूत बनाने में उनकी मदद करता हूँ. So now I call upon Dr. Kiran ma'am, founder, managing trustee of Udyan Care, and our guideline to kindly share with us detail about FIT initiative.
Thank you, Srishti. Thank you, Raja. I am absolutely honored to have such dignitaries and representatives from across the government, NGO sector, our donors, and also members of our community. जो हमारे बच्चे प्यारे प्यारे आपको देख रहे हैं, these are children from our community. So आप लोगों का बहुत बहुत स्वागत. मुझे लगता है आज का दिन हम लोग सबों के लिए एक लंबा दिन होगा, लेकिन बहुत कुछ लर्निंग्स होंगी. जो कुछ हम अपने प्रोग्राम के बारे में बताएंगे, कुछ आप लोगों के सामने जो बहुत अच्छा काम कर रहे हैं फैमिली स्ट्रेंथनिंग पे, उनके पैनल डिस्कशंस होंगे. आप लोगों को उससे काफ़ी जानकारी हासिल होगी और बहुत शेयरिंग एंड लर्निंग होगी. आफ्टरनून में जो हमारा लेबर ऑफ लव है, एक जर्नल जो हमने निकाला था 10 साल पहले, अब उसकी 10 साल पूरे होने वाले हैं और ये 10वें साल में हमने चरण रखा है, तो उसको हम सेलिब्रेट करेंगे. और ये इशू जो है, ये स्पेशल इशू है ऑन ट्रैफिक चिल्ड्रन एंड ऑल्टरनेटिव केयर, तो उसके ऊपर भी एक बहुत अच्छा पैनल डिस्कशन होगा. So I'm really looking forward to a great day of learning, and all the members who are here, dignitaries, everyone, I welcome you once again. Udyan Care's journey has been one that echoes the call of children who even today struggle with their childhood completely shattered and their rights unserved. Along with our time-tested model, Udyan Ghars, which are family homes for children, a care and protection model for children without parental care, we have expanded that to being an advocate for systemic change, actively working towards deinstitutionalization and preventive models in the last many years, based on the fact that ultimately family is the best environment for a child. So I will start my PPT. This technology always.
आपको पहले इसको फोन करना
ये
पड़ेगा।
कर दिया था मैंने ऑन, देखो हो गया ऑन? नो, आई डोंट नो व्हाट्स हैपनिंग। कोई आप लोग कर रहे हो? ठीक है, थैंक यू। लेट्स गो टू नेक्स्ट वन। मैंने अपने कंटेंट को इस तरह से बनाया है, सबसे पहले मैं कुछ प्रोजेक्ट बैकग्राउंड के बारे में बताऊंगी, फिर पिछले 2 साल में 1.5 साल में हमने क्या किया उसके बारे में बताऊंगी, देन आई विल टॉक अबाउट गोल्स, theory of change, 3R approach which we have developed, and then 10 domains of circle of care and protection. Then how we are planning the workflow. All this will be, presented before you. Next, please. हम सभी जानते हैं, all of us know, in all kinds of policies, instruments, any schemes, again and again it is being said that our focus should be on families. Children should be growing up in families. अगर आप देखें मिशन वात्सल्य जो अभी रिलीज हुआ था कुछ समय पहले ही, how it has brought the focus back to keeping children in families. If you look at guidelines for alternative care of children in 2009, there also they are mandating support children to remain with and to be cared for by their family, and removing any child from his family or her family should be a measure of only the last resort. If we come to our JJ Act, here it talks again and again about principle of family responsibility. अगर आप देखते हैं ये resolution on the promotion and protection of rights of children, which was adopted by UN General Assembly in 2019, there also they ask for critical investments to keep families together. अभी 2022 में किगाली में बहुत सारे NGOs मिले थे और बहुत सारे गवर्नमेंट ऑफिशियल्स भी गए थे, हमारे यहाँ से भी जजेस भी गए थे, एंड वहाँ पर we signed that declaration which supports the efforts for tackling causes of separation of children from family and community and discouraged institutionalization. मिशन वात्सल्य का तो मैंने आपको बता ही दिया. Next, please. We know, and even, the government reports have also clearly said poverty is the main reason for institutionalization. बार बार नए एविडेंस निकल के आ रहे हैं पूरे देश में और पूरे विदेशों में हर जगह से कि बच्चों को अगर लॉन्ग टर्म इंस्टीट्यूशन में रखा जाए तो उनको न्यूरोलॉजिकली उनके लिए क्या डिस्टर्बेंस होती है, उनको कल्चर से अपने कल्चर से दूर चले जाते हैं. इसलिए किसकी जरूरत है? कम्युनिटी लेड फैमिली स्ट्रेंथनिंग एंड फैमिली बेस्ड केयर सर्विसेज. आप लोगों को पता ही है एक रैपिड रेस्टोरेशन हुआ कोविड-19 के टाइम में. Almost 150,000 children who were living in institutions were rapidly sent back to their families following the Supreme Court's order. That really was the spur for us to develop a program which is called Fit Families Together, in its first phase in partnership with Martin James Foundation. We developed a pilot जिससे कि उन बच्चों को सपोर्ट मिल सके जो रेस्टोर हुए हैं, उनको किस तरह का सपोर्ट मिल रहा है या वो खाली अपनी फैमिलीज में चले गए हैं, किन चीज़ों की ज़रूरत है उसको समझा जाए और एक पायलट बनाया जाए. Approvals were sought from Department of Women and Child Development, Government of NCT. With the help of the CWC, and especially, we have our CWC members here who went out of their way to help us in one district, which is South District. And the CCI is there. हम लोगों ने काम करना चालू किया, उन बच्चों को ट्रेस करना चालू किया जो बच्चे अपने परिवारों में चले गए थे, वहां जाके देखने की कोशिश की इन बच्चों के संग क्या हो रहा है. नेक्स्ट प्लीज. हम लोगों ने एक छोटा सा एक मॉडल बनाने की कोशिश की. वी कॉल इट 3R framework for reintegration. How did we initiate? We started, locating all these children, and we did assessment of the children and the families. I will talk about it in the next slide. ये हमारा phase 1 था, reaching out. Then in the phase 2, reinforce. इसमें हमने बहुत सारे blueprints बनाए. What we are going to do, how we are going to do assessments, their analysis and everything. Phase 3 is the reintegration process where we start implementing whatever we had learned. Now, way forward is how do you sustain this? This has to be sustained. So year 21-22, we reached out to 280 children. We got the list with great difficulty, but we got the list. And then we started, looking for them everywhere. And we decided that short-term children means children who have been in an institution for less than 6 months. We will not touch them because maybe they are still not impacted a lot by the institutional care. Let's look at those children who have been long-term placement and they have come back to the homes. So what is happening to them? To our utter surprise, 120 children, out of which 66 children we could not contact because migrated or whatever, we could not contact. Finally, we onboarded 54 children. So this whole cycle was identifying beneficiaries through government, phone calls, home visits, हर एक फैमिली बच्चे का इन्फॉर्म्ड कॉन्सेंट लिया गया, उनकी काउंसलिंग की गई, एंड वी हैव डेवलप्ड आवर ओन इंडिविजुअल NABS वी कॉल इट, नीड बेस्ड असेसमेंट सर्वे. उसमें हर एक फैमिली के बारे में, बच्चों के बारे में अलग अलग हम लोगों ने जानकारी हासिल की और उनको किया. We also did a lot of community resource mapping because it's very important to know where the children are, the families are, what kind of resources are available in the community only. Now we come to the second phase, which is reinforce. We are doing everything using case management and participatory approach. So the बच्चे जिनको हमने finally लिया, 54 बच्चे, इनमें 29 girls हैं, 25 boys हैं. अगर इनकी family status देखें, there are 25 single parents. Both the parents are only 20 families and 9 families had no parents. So they were living with their extended family. अगर आप age देखें तो 7 to 10, 13% बच्चे इनमें से 7 to 10 के हैं, 11 to 14, 37% हैं, 15 to 18, 50% हैं. Additional family members. There were younger siblings than the child who was restored to the family. So 45 such children. Their adult siblings, they were also, not getting enough opportunities to work. So they were 17, and caregivers means parents or extended family, 65. So we supported 31 families, but if you look at the numbers, of the family members, it goes up to 181. And we also looked at the experience, which I have already talked about. Minimum unka 1 to 3 years का experience होना चाहिए. इस तरह के 7 बच्चे मिले. 3 to 6 years का experience 19, and 6 to 8 years of experience there were 16, and 8 years of experience there were 12 children. So long-term placements in the institutions. So using our JJ Act, systems, we developed 54 individual care plans. Mental health care pro forma we have designed of our own based on our experience in the Ghar program. So we covered that. Family development plans, 31 families, each family we made their development plans, and youth development plans, how they are going to be working in future. This now we come to the reintegrate. We developed a circle of care and protection, which had 8 domains. Of course, I'll be talking about it later, that how these 8 domains have turned into 10. But right now, till our first year, we had 8 domains, and each child and each family was followed through on these domains of circles of care. We developed exhaustive Excel sheets where each and every activity with the child or the family or action done for them was recorded. We developed a lot of trainings, linkages, and collaborations with government, with other partners, and government schemes, everything which tried to understand and passed it on to the community. There was an exhaustive monitoring system. Every 3 months, we were meeting the families to understand what's going on, and we were all putting it into the data. We were assessing the impact that was making, and if there is a relapse, we were trying to reassess why the relapse and how we can make it better. So the 5th portion is sustainability. So when we went to the communities in the beginning, all these children who had gone back, they were clamoring, please, take us back to some institution, हमें वापस institution में भेज दीजिए, हम तो school के बाहर हैं, हमें ये भी नहीं मिलता, वो भी नहीं मिलता. They were in a very bad shape. And the families, COVID के कारण उनको वैसे ही इतनी परेशानियां थी, और ऊपर से एक added बच्चे का expense. It was just too much. So who were all clamoring to go back to CCIs. उनके साथ साथ community के और लोग भी चले आ रहे थे, हमारे बच्चे को भी CCI में भेज दीजिए, हमारे बच्चे को भी CCI में भेज दीजिए. But after 1 year, I feel very happy to say now none of them are interested in going back. They want to be together with their families. So in this 1 year, it's very small, the achievements we've been able to make. but some little dent has been made, and I'm sure we will be able to carry it through. Most of the children didn't have legal identity, of course, and it was so difficult to change their Aadhaar cards and other things. They had all dropped out of school. So they were put into schools. They were given skilling support. We identified the right, aspirations of theirs and connected it with the right, vocational training, physical health services support, mental health support. We have our psychologist, she's here, and another person, Manan, is also there. So they were continuously going and meeting the children, doing lots of family tree activities and those kind of activities so that the children feel strengthened. Life skill workshops were done again and again. And linkages to scheme, we could do only 12, which we should need to take up further, in a bigger way. And support with livelihood and entrepreneurship, 3 families were supported. So now they're on their own. They're able to sustain. This brings me to our FIT phase 2. Till now, it was more reintegration. But this 1 year's experience made it very clear that reintegration and prevention have to go hand in hand. Because right there in the community, there are ripe cases where the children could, go to CCIs first time or go back to CCIs for those who are restored. How do you stem that? So we developed this prevention program, and we are so grateful that Sari joined us at this stage. So we thought, let's understand what are the vulnerabilities being faced by the community. So we did a survey, October to November. We developed our own formats, and 8 enumerators were trained into it, and 5 pockets in South District of Delhi, they were covered. We used 3 tools, our indigenously developed tool and a case study format, as well as the universal ACE. Additional details, we did community resource mapping, district profiling. We used Kobo toolbox so that, in real time, we could get data, and training, as I've said. 487 households were covered, and out of which 89% were mothers, not just fathers. 89%, we decided to, interview mothers. 30 adults for ACE, and key findings: 76% reported poverty as the cause for institutionalization. 34 families are single parents, mothers. Only about 4% got loans from banks. 20% had no electricity connection. Only 17% were linked to any government scheme. So this is an overview. So almost 2,293 total population were covered. And if you look at the educational status, 67% of adults reported to be illiterate. Next, please. So distribution of the families by monthly income. We thought that it is very important to understand how can we understand what kind of income are they getting? Are they able to sustain their families? So if you look at it, 54.80% people are getting only 5,000 to 10,000 and living in a city like Delhi. It's so difficult. So we have some quote here: after my husband died, the condition of the family became worse. I struggled a lot to feed my children, even 2 meals a day. I earn hardly 3,000 rupees, which is not sufficient. So we saw that most of the families have more than 5 members. Maximum families are earning between 5,000 to 10,000. Few families have no stable income. Almost 96% of the families still don't have toilets, and they're depending on public facilities. On ACE, we covered only 30 people on ACE, and we discovered, I don't know how much they understood that adverse childhood experiences, but at least 2% women, they said they faced most of their adverse experiences, not childhood experiences, after getting married. And so they are single mothers. So domestic violence, desertion, alcoholism, non-cooperation, death of spouse, poverty, substance abuse, insecure living conditions. We know all this. These are some of the quotes that I will just read out because time is also less. I sleep in fear of displacement. Concerned about the uncertainties, I was waiting to send them back to the hostel. For them, a CCI is not a CCI. It is a hostel. So they take it as a hostel where the children can go and get food, get education. But when I was told that children grow best in families, I decided to keep them with me. Another person said, without husband or any support, I found it tough to keep my children when they were given back to me. And I requested the team to find another good CCI. But after counseling and guidance, I now spread the word to my neighbors that they should not send their children away from them. Approach. We studied a lot of models, even in the first phase, the Thrive scale, which is such a beautiful scale, family assessment form, FAF, active family support, nurturing care framework, nurturing family resource checklist, North Carolina family assessment scale, and Udayan Care's own experience of 29 years serving our children, and the first year in the Fit Family. And it came out very clearly. We had made a 8 domain circle. Now with Seri joining in, we extended it to 10. So now we have this 10 circle of care and protection. I'll talk about it in the next slide. Next, please. If you look at it, that these domains are very clearly, we tried to define. We also developed indicators for each one of them, and also activities. If we want to reach there, those indicators, what can be the activities? So if you look at basic needs and safety, food, shelter, these are basic needs. Food, shelter, clothing, freedom from actual risk of trauma, violence, or addiction. So this was covered here. In household finances, it goes a step further. Will they be able to have sustainable livelihood and financial resources and management above basic needs? Then comes the third one, physical health. Understanding, the families also must have the understanding of overall health and disability, and how do they access services. The third one, mental health. They have to have this sensitivity and understanding about mental health issues of self as well as the family. And how do you do that? So we have developed indicators, we've developed activities, quality opportunities for advancement, which covers education and vocation. How do you go ahead in life unless you are given education and vocation training? Then if you look at child awareness, here it's not enough for the family to be aware, but the child also must be aware. That's why we made it a separate domain. They should be able to identify their own feelings, their emotion, their strengths and aspirations. Then community and social connections, which is a very, very important, aspect of it. They must participate with individuals and groups without any fear and express themselves. Legal entitlements. Most of the time, the identity papers are not in place, so they are not able to identify, they are not able to apply for the schemes. So how do we help them in documentation, and how do they get social protection schemes? Positive parenting. Over and over again, all over the world, it is being talked about that parenting skills need to be imparted. I don't know how many of us also have enough parenting skills, but still, people coming from rather uneducated backgrounds, they really need to be trained into parenting skills. Hope and faith. This is the last one. It's a little bit abstract, but I think it's very, very important for us. Belief and trust in the possibility that good can occur. What we realized, most of the families were feeling so hopeless. Kuch nahi hoga, aap aa gaye ho aaj, kuch kar jaoge, fir chale jaoge. They were not feeling hopeful. How do we bring that hope back to them, and that you are deserving? Nobody is doing anything for you. You deserve it. It is your right. We are not doing anything special for you. So this is how we developed these 10 domains. It has been a very, very iterative and learning process throughout. As I said, that documentation templates were developed, district stakeholder convergence meetings were initiated, in which our DCPO, our CWC, Anganwadi workers, and the community itself, then other NGOs and CSOs, we tried to bring in a lot. Recently, we did one convergence meeting at, Butterflies at Rita Ji's place. Community ambassadors started emerging. They started taking up the cause and telling others that, you can do something. So this is, I think, a most beautiful part. And children's group, they started forming themselves. And we did the baseline and endline of the first year and baseline for the second year. 3R framework, which I showed, it was further developed to include prevention. Circle of care and protection, which I showed earlier, it had 8, and now it has 10 domains. And case management workflow. I will be talking about that workflow also in the next. And indicators and activities for each domain were developed and are in a constant process. I mean, you can't say that now it is done, because every day a new learning. Criteria for further family support and graduating out a program being further honed. No family should be there forever as a recipient. How do you graduate them out of the program? For that also we are working. So one thing that we understood again and again, Reunification, it's a learning. Reunification and reintegration is a process. Never one-stop solution that you give the child back and everything is okay. It doesn't happen like that. It requires preparation, actual support, being there for them. I'm here. If you have any problem, you can come, and follow-ups. And this is not only one NGO is working. It is the entire stakeholder group. They have to take the responsibility. It requires adequate funding, linkages to schemes from government, also private players, we realize, and collaborations with different stakeholders. It is important to pilot, demonstrate, and then scale. You really start feeling excited that you are able to make some difference, and why not scale? So I think it's very important to think like this. This is the workflow. It's a little bit of a, quite a eyeful. But again, I will just explain very quickly in reach. How do we reach? Community outreach and mapping, as I said, and referrals. So sometimes the community mukhya is telling, sometimes the other people are telling this family is in need. So there you are also thinking of referrals, and we have our determination tests. So on that, we find them. Then family assessment as a baseline, that's our baseline. And baseline is on 10 domains. Then we come to reinforce. In this, care planning. As I said, even in the first phase, we were doing a lot of care planning, entire case management system we are doing, case follow-up, finally, regular visits, revised case plan, no care plan. When you make it, it will be, it will be the end. You have to continually meet the families and continually understand what's going on and improve, reintegrate. So program graduation, when do we graduate them out of the program? So end-line assessments, they have been developed. So transition to graduation, and then our dream is they will start giving back, just the way our community ambassadors have already started emerging. So they don't have to give only in terms of money. They can do so much more by giving the positive messages to others. Earlier, what used to happen, एक ने कहा मेरे बच्चे को CCI में भेज दो, सबों ने कहा मेरे बच्चों को CCI में भेज दो. अब एक बोलेंगी कि नहीं, CCI में जाने की जरूरत नहीं है, हमारे पास रहे बच्चे. और लोग भी फिर वही बोलेंगे ना, तो इसलिए इनका बहुत बड़ा रोल है. And then continued support. And it should all lead to advocacy and system strengthening, and for which we have so many of NGOs who will be sharing their work, and they are doing such massive work. So it is going to be a great platform for learning and sharing and understanding what else can we do individually and together. Then the whole cycle starts, referral of other families. We have this graduation plan. High touch, medium touch, low touch. High touch means they really need close support and guidance, high level of risk they are facing. Medium touch, they are becoming self-sufficient, but they still need support. In low touch, they are ready to move out of direct support, but need handholding support, ready to start giving back. So far, in the last 1 year, we have seen 12 families. Out of those 31 families are moving from high to medium touch, and 8 of them now in the low touch category. So very soon, hopefully, they will be graduating out of the program. So whatever we are doing with the families that we have finally assessed and taken them into the program, there it is being done more exhaustively. But whatever we do in the community, there are health camps, there are other donation drives and counseling and teaching, to the children in the community. Anybody needs their Aadhaar cards or any other cards, anybody needs to be linked to a scheme. So the larger community is also getting benefited. So this is, our goal: child in the center, families, caregivers, communities. Caregivers we have written separately because these caregivers could be stakeholders also, like us. So in families, they should be safe, strong, functional, resilient. Caregivers have to be empowered, hopeful, connected, and intentional. They should have the intention to be able to do some good for them. And communities have to be strong, connected, participative, and they have to have ownership. So in a way, our theory of change emerged. Every child, with or without experience of institutional care, grows up in fit families together. It is absolute clear understanding children grow up in families, not in programs. We cannot achieve great outcomes for children without engaging with their parents and families. So when we are meeting a child, it's not possible not to meet the family and make them as our partners. So this has to be integrated in the existing system of holistic child rights, linkages to different services for education, health, nutrition, protection, development, and most important, participation. We have to make it a very, very participatory process. And is it possible to eliminate all kinds of risks? I don't think so it is possible. So what we need to develop is tools and techniques and train them to be able to mitigate and cope. So these are very important things. We are consistently working towards establishing a dedicated workforce of qualified case managers and psychologists trained in case management, clear guidelines and tools for assessments and planning, close collaboration with district child protection functionaries and allied departments, whether it is education or health, as well as CCIs, other CSOs who may not be CCIs, but they can, support in many ways, and donors as our partners. We need to continually update ourselves on schemes, and we have started writing down SOPs for linkages and referrals. Our focus is on quality documentation. So all children thrive in safe and nurturing families. Thank you for giving me time so patiently.
Thank you, Kiran ma'am, for the lovely presentation. So the family is the best place for children to thrive. And this is clear to all of us. Now let's hold our breath to listen to our community and community members and our children. Please put your hands together for an exciting skit presentation. Shatak, please welcome our lovely children who have prepared a Nukkar Natak based on our two main objectives, reintegrating restored children and preventing unnecessary separation. तो आइए हम स्वागत करते हैं अपने बच्चों का.
नमस्ते, मेरा नाम मीना है। मैं अभी के वर्ष में पिछले 2 वर्षों से बच्चों के स्वास्थ्य, मानसिक स्वास्थ्य, उनके लीगल डॉक्यूमेंट और उनकी पढ़ाई से संबंधित कार्यों पर काम करती हूँ। इसी तरह अब मैं आपके भी साथ काम करूंगी और हम सब मिलकर मदद करेंगे कि आप अपने बच्चों को वो ना करें। बहुत बहुत धन्यवाद आप सबका। मैं अब अपने बच्चों को आप लोगों की मदद से अपने पास रखूंगी और मैं खुद अपने बच्चों के साथ रखकर उनकी बेहतर परवरिश करूंगी। आप लोगों का बहुत बहुत धन्यवाद। आप नहीं जानते आप सबने मिलकर मुझे कितनी खुशी दी है। मैं अपने बच्चों को मुझसे कभी भी दूर नहीं करूंगी। लो भारत, इधर आओ बेटा, जल्दी आओ। उसे कह दो हाय 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 हाय, जो दिल ना लगे उसे कह दो बाय 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 बाय। आने दो दिल में ना जाने दो, कह दो मुस्कुराहट दो हाय 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 हाय। लव यू जिंदगी, लव यू जिंदगी, लव यू जिंदगी, लव यू जिंदगी।
थैंक यू बच्चों।
और जो अभी आपने नाटक देखा उसका नाम है सशक्त।
थैंक यू बच्चों। तो कैसा लगा आपको हमारे ये नाटक? अगर तो एक बार जोरदार तालियां बच्चों के लिए। हाँ, इंडीड बहुत अच्छा नाटक था। इन बच्चों ने एग्जाम इतने कम समय में अपने एग्जाम होने के बावजूद भी इतनी अच्छी प्रैक्टिस की और इस यानी इतना अच्छा मैसेज हमें कन्वे करवाया। तो थैंक यू बच्चों। मैं आप सभी को इन बच्चों के कैरेक्टर का परिचय करवाता हूँ। वैष्णवी चिल्ड्रन ग्रुप लीडर, आप अपना हाथ दिखा दीजिए बच्चों। साक्षी एनजीओ बेनिफिशियरी, मुस्कान सोशल वर्कर, रिया सोशल वर्कर, सिया यूथ ग्रुप लीडर, पूनम नेवर, सलमान रोहन, बंटी रोहन फ्रेंड, समीमा जी मदर ऑफ रोहन, निमरा एनजीओ वर्कर। ठीक है, आप लोग जा सकते हैं। हाँ सॉरी।
सबसे पहले तो हमें धन्यवाद करना है शिवांगी का। Shivangi, she is a National School of Drama product herself, and she's working with a very big theatre group, Bhumika. So she volunteered her time, and I mean, we are really grateful. बच्चों ने इतनी अच्छे से, इतनी कॉन्फिडेंस के संग किया कि देखने लायक था। थैंक यू शिवांगी।
Thank you, Shivangi ma'am.
Thank you, ma'am, and thank you, बच्चों. Okay. So let's now begin with our first panel discussion with our project beneficiaries and stakeholders who have supported us along our journey. We have a panel of stakeholders with us today to discuss on the topic Understanding the Fit Families Together initiative. तो अब समय है हमारी फर्स्ट पैनल डिस्कशन का हमारे स्टेक होल्डर्स के साथ. We would like to call Ms. Leena Prasad, Associate Director, Advocacy Research and Training, Udyan Care, on stage to invite our panelists and chair the discussion on Understanding the Fit Families Together initiative. So before the panel discussion, because sir has, we feel really honored to have the guest of honor with us, Mr. Anurag Kundu. So, sir is the chairperson of Delhi Commission for Protection of Child Rights, DCPCR, Government of NCT of Delhi, a position equivalent to Principal Secretary, Government of Delhi. He is responsible for monitoring the implementation of rights of the nearly 5.5 million children in Delhi. Commission research studies, inquire into specific complaints, violation of the rights, and advise the government on policy matters on the issue of early childhood care and development, school education, protection of children from physical, mental, sexual violence, child labor, early marriage, substance abuse, and trafficking. I would request you, sir, to please.
It's a joke and take it like that only. But very often I hear things like the kind of description that you read. I feel that this is what an obituary feels like. And then perhaps if the last sentence is ki overall अच्छे इंसान थे, that will complete the obituary. But good morning, everyone. Thank you very much, ma'am, for the invitation and for the opportunity. Before I come to the subject, few things just want to establish and get them off the table before I come to the topic. And the first and foremost is there is absolutely no need to be grateful to any public servant, because when we are grateful to somebody, it's hard to raise questions to them. And it shouldn't be hard to raise questions to public servant. Your primary responsibility lies in criticizing me and the institution I represent. Your primary responsibility lies in asking questions. Your primary responsibility lies in finding faults in all that we do so that we can do better. So that's the first thing that I wanted to get at the table, because I keep hearing honor, dignitary, thank you, then more thank you, and then more thank yous, and there is absolutely no need. Please ask questions, and that's what public servants are for. And I was telling when I was early in the morning before the start of the, and there's beyond the ideas of or the philosophy of the democracies and the role of public servants in discharge of responsibilities in a democracy, there's one more reason why public servants need not be thanked. I get a salary to do what I do. So since I'm not doing for free, and I am in that sense a burden on the exchequer, being paid by your taxpayer money, then what's the need to be thankful? Anyway, so just wanted to get that one thing off the table before I get started, and now let me return to the subject. I was incredibly, I had a barely 30 seconds interaction with Pooja before I entered the seminar room, and I'm very personally happy to see Raja do so well in anchoring. And I think these two people are live testimonies to the kind of work Udyan Care does. Well, let me speak less of Udyan Care. Let Udyan Care speak for itself through its own demonstrated work, and let me not do that. Let me return to the topic, and let me say a few things categorically. A child's place is in a family, period. It's only in rarest of the circumstance when the family ceases to exist for reasons such as abandonment, for reasons such as death, or reasons where the family has proven catastrophic for the upbringing of the child. But those are extreme and extremely rare. That means the 99.999% cases, it doesn't apply. And therefore, the threshold of separation of children from the family can't be less. It has to be very, very high. Because in whatever little way that I've learned that children don't grow up, they easily grow up in deficiency of resources environment, but they don't grow up when the love is deficient. And a children home or a child care institution, as the legal term is not really a home. It's only euphemistically called so. And that's what we need to understand. Some of our children homes or the child care institutions in Delhi have started to do much better. And let me explain what that better looks like. Children now have better blankets. Children now have better beddings. Children now have more diverse and more nutrition-rich food. They now have more notebooks, more timely books. And they now have better flush system in the toilets. And all of that is, of course, required and important. But I'm saying despite that, they're not home. And they can never be. Because a bunch of people, and those bunch of people can be remarkably empathetic. And those bunch of people can be remarkably compassionate. And those bunch of people can be remarkably good human beings. But yet they are not the chachas or the mamas or chachis or mamis or mummy or papa or bhai or behen. And that's a different kind of love altogether. And therefore, I'm very happy to hear the intervention that Udyan Care has in ensuring that the families are strengthened. Because the primary responsibility of raising and upbringing a child lies with the family. However, there may be circumstances that are leading to families having struggle. So then our collective job is not to ensure that, this family is struggling to raise its child, so let's separate the child. No. Then our primary responsibility, I speak for the state that I represent, the primary responsibility for the state is to chip away the struggle the family is in. That struggle may be financial in nature, and that's where the government schemes of different financial assistance comes into the picture. And it's a sorry state that only 17% families had access to different government schemes, going by the findings that you presented, ma'am. This number must increase from 17 to 100. So the first or the remarkable barrier could be financial in nature. And often, and as the findings presented by ma'am also show, that poverty is the biggest reason of institutionalization. Poverty should never be a reason for institutionalization. The only thing poverty should lead, or the existence of poverty should lead the state to do, is to ensure that poverty alleviation happens. That's the only way out. So one of the big barrier could be financial in nature, and that's where the government financial assistance schemes such as Mission Vatsalya, or depending on specific circumstances of a child, could be widow pension, could be disability pension, could be elderly pension, could be help in the form of public distribution system ration, or in any other way. So that's could be the first important barrier or struggle the families may have. The second important barrier that, at least in my limited experience, and please correct me, ma'am, if I'm wrong, or add if I miss out on any point, is often the access to different government institutions. And when I say the word institution now, I don't mean CCI. When I say access to different government institutions, I mean schools. And access does not always look in the form of absence of a paper called enrollment. The access could manifest in many different ways. The access or the lack of it could manifest in the form of poor quality toilets for adolescent girls, leading to them attending less or not attending or dropping out. The access could be in the form of different manifestations of caste-based discrimination, leading to the institution being inaccessible for that specific child. The access or the lack of it could manifest in the form of the gender prejudice we may have for transgender children. So my point, the limited point being that the second big barrier that often families or their children often face is the lack of access to the institution, and access in a broader sense of the term, not a limited sense of the term कि नाम तो लिखवा दिया है, हो तो गया access का problem solve. That's not the access. Getting a child enrolled in a random register of a school is a beginning of access. It is not access per se. And the government institutions could be then other, for slightly more adolescent children, could be vocation or skills building institutions, or far younger children could be in the form of Anganwadis, where they get hot cooked meal, and more importantly, get the immunization, which helps them do better on many health indicators, not just one. So the point being access to institutions, and that institution could also be hospital, as and when not just the child, but when the families require help. And I will link it back to the last point that I would make. So the second big barrier that we as state, and you as the organization responsible for supporting the state and asking questions to the state, we should be looking into, is the access to different government institutions. So the financials and the government institutions. And the last, that could be the barrier for this family. I mean, I don't know how, at least I have yet not cracked how to solve for this in Delhi's specific context, is the housing and livelihood. And since I have very limited understanding, at least so far, I have not been able to even crack a little bit how to solve for these two aspects, the housing and the livelihood, I have very little to add. But I'm cognizant of the fact that this is a remarkable barrier, often resulting in the family not being able to raise the children that they're both capable of and want to. So I think these are the three. And last, and this is perhaps more of a takeaway for the government, less of for you, as you have already displayed a far better understanding of this concept than we do. But nonetheless, I would still, at least in terms of thinking out loud, do so. And which is, unfortunately, governments tend to see, if I want to help a child, we tend to see child as a standalone entity. And so long we don't see the child as part of a family, and unless we see our nature of intervention, our format of intervention, our extent of intervention in terms of family as a unit, I'm not sure we would be able to make the kind of difference we want to make. We would perhaps still make some difference, but not the kind of difference that the country requires us to make, or these children require us to make, or that we hope to make. So how do we strengthen family, and how do we envisage family as a unit when it comes to different state interventions in strengthening and supporting them, is a key question that I need to reflect, that my colleagues in the government need to reflect, and perhaps seek better answer. And some of them, I have no doubt, will come from you. Thank you very much.
It was inspiring listening to you, sir. We feel all children in Delhi are in safe hands under your leadership. Okay. Thank you, sir. We are grateful for your presence, sir. Thank you, sir. May I request Miss Anjali Hegde, Executive Director, Udayan Care, to present a token of appreciation to sir. Sir, आप प्लीज दोबारा आ जाइए. बच्चे चलेगा क्या?
We have dealt with a lot of public servants, and I must say that this is a very interesting thing, and we really do appreciate that in your time. Thank you.
थैंक यू मैम. लीना मैम, आप कंटिन्यू कर सकते हैं पैनल डिस्कशन के लिए.
तो मैं अपने पैनलिस्ट साथियों को बुलाना चाहूंगी डाइस पे. मेरे साथ है जमादी, जो हमारे बच्चों और युवाओं को रिप्रेजेंट कर रही हैं. जमादी आ जाइए. मेरे साथ है दिव्यानी, जो आंगनवाड़ी वर्कर है हमारे लोधी रोड सेंटर की. दिव्यानी प्लीज ज्वाइन मी. पूजा है हमारे साथ, जो हमारी कम्युनिटी एम्बेसडर हैं. पूजा. शमीमा जी है, जिनको आपने नाटक में भी देखा, और जो हमारी पेरेंट ग्रुप को रिप्रेजेंट कर रही हैं आज. वैदेही मैम, जो हमारी CWC चेयरपर्सन है साउथ डिस्ट्रिक्ट ऑफ दिल्ली. देन मे आई इनवाइट वरुण सर, हु इज द DCPO साउथ डिस्ट्रिक्ट ऑफ दिल्ली. May I invite Seema, who's representing our partner, Martin James Foundation. And last but not the least, Devashish, to represent Siri, our partners. I think we need another chair for Devashish. आप आइए, आप यहाँ बैठिए. I'll moderate from there. मैं moderate करती हूँ आपको. No worries. आप बैठिए.
ये चेयर वहाँ चली जाती है ना?
नहीं, कोई बात नहीं है. It's okay.
Are you sure?
या वहाँ पे जगह भी नहीं है, बहुत कम जगह है. हमारे कम्युनिटी प्रधान भी है हमारे साथ. सलीम भाई, प्लीज आप आइए. एक और कुर्सी, टीम प्लीज डाइस पे कुर्सी लगा देंगे प्लीज. I think मेरी सौभाग्य है, in fact I am lucky that I am being given this responsibility to moderate a session जिसमें हमारे most important stakeholders हमारे साथ हैं. You know, these are the people who we've been working for the last more than 1 year directly, day to day. हम इनके साथ काम कर रहे हैं और ज़्यादा वक्त नहीं लूंगी मैं. और मैं सबसे पहले हमारे जो युवा चैंपियन है, और इनको जब भी मैं सुनती हूँ तो आई एम लेफ्ट विदाउट वर्ड्स, जमादी. तो मैं इनसे रिक्वेस्ट करूंगी कि ये अपनी जो जर्नी है रेस्टोरेशन के बाद का, उसके बारे में शेयर करें, और उसके बाद उनको कैसा लगा तब से, जब से ये सीसीआई से रेस्टोर हुई हैं, अपने फैमिली में वापस आई हैं, तब से अब तक का जो आपका सफर रहा है उसके बारे में आप शेयर करें.
हेलो, हाँ, आवाज आ रही? हेलो, गुड मॉर्निंग फ्रेंड्स, गुड मॉर्निंग टू ऑल ऑफ यू. माय नेम इज चिमादी, और मैं, जैसे कि मैम ने बताया, मैं सीसीआई में पहले स्टडी करती थी और मैं भी 12th पास आउट हूँ और वोकेशनल कोर्स कर रही हूँ 1 ईयर का डिप्लोमा, और अभी उसमें स्किल्स वगैरह सीख रही हूँ. बाकी उसके अलावा जैसे मैम ने बोला 1 ईयर के एक्सपीरियंस में तो बहुत सारे बैड एक्सपीरियंस भी थे, गुड भी थे, मिडिल भी थे, हर एक चीज़ थी. क्योंकि जैसे हम सीसीआई में थे तो उसमें सारी स्टडीज वगैरह होती है, आपको नीड हर एक चीज़ पूरी हो जाती है. लाइक आपको स्टडी चाहिए, डिसिप्लिन, क्योंकि सीसीआई में सबसे एक बेस्ट क्या होता है कि डिसिप्लिन. आप सुबह उठते हो, नहाते हो, अपने टाइम टेबल को प्रॉपरली यूज करते हो, क्योंकि कम्युनिटी में ऐसा नहीं होता. आप स्कूल से आते हो, बैग उतारते हो, सो जाते हो. ऐसा मैंने देखा है, क्योंकि 1 साल में मैंने ऐसा एक्सपीरियंस किया है. पर हमारे सीसीआई में क्या होता है कि आप डिसिप्लिन को बहुत अच्छे से मेंटेन करते हो, आपकी जरूरतें पूरी होती है, हर एक चीज होता है. पर जो एक इमोशनली सपोर्ट चाहिए होता है, लाइक हम जब अकेले होते, हम क्योंकि जैसे सीसीआई में रहते तो पूरा टाइम वहीं रहते, फ्रेंड्स के साथ ठीक है टाइम स्पेंड किया, पर जो एक बच्चे का पिलर होता है, क्योंकि हर एक चीज को, जैसे प्लांट को पानी की जरूरत होती है, ऐसी एक बच्चे को पिलर के तौर पे एक फैमिली की नीड होती है. कि जब हमें किसी भी इमोशनल, कोई भी हमें ऐसा कोई आए, फिजिकली, फाइनेंशियली, कुछ भी ऐसा सपोर्ट हो, जब हमें किसी से शेयर करना हो, तो हम ट्रस्ट करते अपने ही मेंबर पे, ना कि किसी फ्रेंड्स पे हम करते बहुत कम करते. और अगर हमारे पास अगर अच्छे दोस्त ना हो तो हम फिर किसी से शेयर ही नहीं कर पाते. तो यही रीजन था कि मैं सीसीआई से वापिस आई थी. सीसीआई में ऐसा रूल होता है कि आप 18 के कंप्लीटेड है तो आप निकल सकते. पर क्योंकि मेरे को बहुत ही ज्यादा नीड थी कोई इमोशनल सपोर्ट की, और जब मैं सीसीआई में आई थी तो मेरी मदर थी मेरे साथ. मेरी मदर 3 साल थी, उसके बाद मेरी मदर मुझे पता नहीं कहाँ छोड़ के गई है, और आज तक शायद मुझे नहीं पता उनके. तो उसकी वजह से मैं बहुत ज्यादा डिप्रेस थी. बहुत मुश्किल से मैंने 12th पास किया. फिर उसके बाद मैंने बोला नहीं, मुझे अब मेरी सिस्टर के पास जाना है, जो कि मेरी एल्डर सिस्टर है. तो उन्होंने भी मुझे बोला कि नहीं, मैं सपोर्ट करूंगी तुम्हें, तुम आ जाओ घर में, जो भी है मैं उससे तुम्हें सपोर्ट करूंगी. जब मैं फर्स्ट टाइम घर आई तो अच्छा था फर्स्ट डे का एक्सपीरियंस. उसके बाद पता चला कि अच्छा घर में काम करना भी पड़ता है. तो काम से स्टार्ट हुई एक्सपीरियंस. तो थोड़ा बुरा भी लगता है कि रोज रोज सुबह उठना है, काम करना है, और अपने लिए नाश्ता भी बनाना है. क्योंकि हमारे घर पे क्या होता है, होम में क्या होता है, लाइक सीसीआई में आपको टाइम टू टाइम सारी चीजें मिल जाती है, पर उसमें कोई काम वाम नहीं करना है. हमारे घर में होता है कि हाँ तुम्हें काम भी करना है, अपने लिए नाश्ता भी बनाना है, और अगर दीदी बीमार है, कुछ है, तो आपको डिनर भी, सारी चीजें करना है, एजुकेशन को भी देखना है. और मैं 12th में स्टडी कर रही थी तो मेरे लिए बहुत ज्यादा दिक्कत होता था. दूसरा प्रॉब्लम ये था कि मुझे सर्वाइव करना नहीं आता था, लाइक कैसे बस में ट्रेवल करूँ, क्योंकि कभी नहीं किया है सीसीआई में, कभी अकेले नहीं गए, हर एक चीज दीदी के साथ है ना, उन्होंने हमेशा सारी चीजें. तो उस टाइम बहुत ज्यादा मुश्किल हुआ, क्योंकि एनवायरनमेंट मेरे लिए बिल्कुल नया था. बेशक वो मेरी दीदी थी, मेरी ही है, पर बिल्कुल ऐसा लग रहा था कि वो मैं उन्हें जानती नहीं. सिर्फ और सिर्फ ये लॉन्ग डिस्टेंस की वजह से हुआ, क्योंकि मैं 7 साल सीसीआई में रही और मैं शायद बहुत ही रेयर उनसे मिलती थी, और मुझे पता भी नहीं था कि जब मैं घर आई तो वो बिल्कुल कैसी, लाइक उनका एक्सपीरियंस, मतलब वो अलग इंसान लगी मुझे. उनका जो भी बिहेवियर था, मुझे लगा वो तो मेरी सिस्टर है ही नहीं, कि अचानक से एक नया एनवायरनमेंट होता है, आप एडजस्ट नहीं कर पाते अपने आप को, और फिर चीजें होती है तो आप शेयर भी नहीं कर पाते, क्योंकि आप रिलेट नहीं कर पाते कि अच्छा ये मेरी दीदी है, क्योंकि बातें नहीं बनती है. तो हमें लगता है कि नहीं, ये कैसे शेयर करे, किससे करे. तो हमें चाहिए होता है कि कोई हमारा फिर से हमें सीसीआई भेज दो, क्योंकि हमें पता नहीं होता. जब हम वहां होते तो हमें लगता नहीं कोई फैमिली सपोर्ट चाहिए, क्योंकि इतने लॉन्ग डिस्टेंस में रहे फैमिली से, तो बहुत ज्यादा दिक्कत हुई. फिर उसके बाद थोड़ा थोड़ा धीरे धीरे चीजें सीखा. फिर पता चला कि नहीं, मेरी दीदी है, वो मेरे को हर एक चीज में सपोर्ट करती है. फिर मैंने उनसे इमोशनली अटैच हुई, उन्हें चीजें बताने लगी, तो उन्होंने भी मेरी सपोर्ट किया, हर एक चीज में साथ दिया. बेशक वो एजुकेटेड नहीं है, पर वो इतनी ज्यादा इंटेलिजेंट है दिमाग से, क्योंकि उन्होंने बचपन से हर एक चीजों का एक्सपीरियंस किया है। आज वो 21 ईयर्स की है, पर उन्होंने 21 ईयर्स में बहुत सारे बैड एक्सपीरियंसेस देखे, और हमेशा कहते हैं कि आप सीखते हो तो बैड एक्सपीरियंस से सीखते हो, गुड एक्सपीरियंस से कभी भी आप सीखते नहीं हो। तो उन्होंने बहुत सीखा है और उन्होंने हर एक लाइफ में मेरे को सपोर्ट किया। जब भी मुझे इमोशनली सपोर्ट की जरूरत पड़ी, आज भी मैं अपनी दीदी के पास जाती हूँ तो मैं बहुत ही लगती हूँ कि मुझे वो मेरी दीदी मिली है, और मैं अपना डिसीजन ली थी सीसीआई से आने का। और आज, पहले तो मुझे पछतावा होता था कि मैं क्यों निकली, क्योंकि मुझे निकाला नहीं गया था। उन्होंने बोला नहीं आप और स्टडी कर सकते हो यहाँ पे, सॉरी। पर मैं खुद निकली तो मेरे को पहले पछतावा होता था, पर अब मैं बहुत ही फील अच्छा करती हूँ कि मेरी दीदी के साथ मैं रहती हूँ। और थैंक यू सो मच।
सो थैंक यू जमादी, आपने अपना एक्सपीरियंस बहुत अच्छे से शेयर किया। Just for the convenience of the other people who will not understand in Hindi, I'll quickly wrap up in 3 points what Jamadi has shared with us. So besides sharing her experience of the journey away from institutional care to family care, she says that like every plant needs a water, every child needs a family. And around that family, there has to be an ecosystem to support that family. And she also very beautifully presented that we all learn from our bad experiences. That shows Jamadi's resiliency. Okay, great. So I'll move on to the next speaker, who's equally important, Shamima, who's representing single mothers. We've been working with almost 17 or 20 single mothers whose children were restored back during COVID. So Shamima ji, आप प्लीज शेयर करिए कि आपका पूरा जो सफर रहा, बच्चे वापस आए कोविड के टाइम पे, तब से अब तक आप कैसे इस सारी अपने एक्सपीरियंस को देखती हैं।
नमस्ते, मैं शमीमा हूँ, जैसा कि मैम ने बताया है।
माइक ऑन कर लीजिए।
मेरा एक्सपीरियंस अभी तक बहुत अच्छा रहा है। पहले तो इतना नहीं मेरे खुश रहती थी, लेकिन अब मैं बहुत खुश हूँ अपने बच्चों के साथ। बच्चे मेरे यहाँ पे मेरे साथ रहते हैं। मेरे बच्चे पहले सीसीआई में रहते थे, होम में, और कोविड के दौरान मेरे बच्चों को वापस मेरे पास भेज दिया गया था, और मैं अपने बच्चों के साथ यहाँ रहती थी, और मेरे को बहुत सारी परेशानियों से जूझना पड़ता था। ना ही तो मैं अपने बच्चों को सही ढंग से उनका खाना पीना या किसी चीज की जिम्मेदारी उठा पाती थी, ना ही उनको पढ़ाई लिखाई के लिए मैं उनको टाइम से किसी चीज की जरूरत पूरा कर पाती थी। और मैं छोटा सा एक दुकान लगाती हूँ, और मैं उसी से अपनी रोजी रोटी चलाने की कोशिश करती हूँ। फिर वापिस से मैं अपने बच्चों को सीसीआई भेजने के लिए सोच रही थी कि मैं इनको जरूरत यहाँ नहीं पूरा कर पा रही हूँ, वापस से मुझे दोबारा से मुझे भेजना पड़ेगा सीसीआई, पर मैं अपने बच्चों से दूर नहीं होना चाहती थी। इन्हीं सब उलझनों में मैं हमेशा रहती थी, बहुत ज्यादा टेंशन रहती थी मुझे। फिर बाद में मेरी मुलाकात इनसे हुई। मैम उद्यान के से लोग आए मेरे पास, और उन्होंने मेरे को उम्मीद दी कि आपकी जो भी परेशानी है, आप जो भी करना चाहते हैं, आपके बच्चे आपसे दूर नहीं जाएंगे। आप ये बताइए कि आप अपने बच्चों को कैसे अपने पास रख सकती हैं, और उनकी देखभाल आप यहाँ रख के कर सकती हैं या नहीं कर सकती हैं। मैंने उनसे बात की, उन्होंने मेरी बहुत मदद की, मुझे काम करने के लिए बताया कि आप इस तरीके से काम कर सकते हैं और हम इस तरीके से आपकी सारी मदद कर सकते हैं। उन्होंने हर तरीके से कोशिश की, मुमकिन कोशिश की कि मैं अपने बच्चों को अपने पास ही रख पाऊं, और मैं अभी रख भी रही हूँ। इतनी ज्यादा इन्होंने मेहनत की, मेरे डॉक्यूमेंट्स, मेरे बहुत सारी चीजें इन्होंने भाग दौड़ करके मेरी सारी जरूरतों को पूरा करवाया, और मेरे बच्चे आज मेरे साथ खुश हैं, पढ़ लिख रहे हैं, और मैंने वापस से उनको सीसीआई में नहीं भेजा, और ना मैं चाहती हूँ कि वो जाए और मुझसे दूर जाए, क्योंकि सीसीआई में होम में रहने के बाद मेरे बच्चे मुझसे थोड़ी दूरी बना चुके थे। जब वो मेरे पास रहते थे तो उनका हमेशा रहता था कि जैसा कि अभी इन्होंने कहा कि वहाँ पे टाइम टेबल से सब कुछ होता है, टाइम पे नाश्ता मिलता है, टाइम पे खाना मिलता है, टाइम पे स्कूल जाना होता है, टाइम पे ब्रश करना होता है, हर चीज टाइम पे होता है। मैं अकेली अपने घर में अपने बच्चों की जिम्मेदारी पूरा जिस तरीके से कर रही थी, मुझे अपना काम भी देखना है और अपने बच्चों को भी देखना है। मैं टाइम पे उनके लिए कुछ भी नहीं कर पाती थी। तो अब ऐसा है कि मैंने धीरे धीरे उनको भी समझाना शुरू किया कि हर चीज मैं आपके लिए पूरा नहीं कर सकती हूँ, लेकिन मैं कोशिश जरूर करूंगी कि मैं आपके लिए हर चीज पूरा कर सकूं। और उनके लिए मैंने अपने पास के सरकारी स्कूल में उनका एडमिशन करवाया है, जो बहुत मुश्किल हुआ मेरे को वापस होम से आने के बाद, कि बच्चे वहां रह रहे थे और मैं यहाँ पे आके अपने अचानक से एडमिशन कर रहे हो। बहुत प्रॉब्लम हुई, उसकी वजह से मेरा काम भी छूट गया। मुझे बहुत परेशानी हुई काम ढूंढने में। दोबारा जब काम नहीं मिला तो मैंने एक छोटी सी चाय की रेहड़ी लगाई और उसी से अपना घर का गुजारा कर रही हूँ। थैंक यू।
Thank you, Shamima. So Shamima is the voice of the many single mothers that we see in communities, struggling, lots of challenges. But if there is a system to support them, they're able to take care of their children as they keep them close in the family. शमीमा जी, अगर मैं रिक्वेस्ट करूं, आप जो कम्युनिटी एम्बेसडर्स वाला कॉन्सेप्ट है जो आप बहुत मेहनत से काम कर रही हैं, उस पे 2 शब्द बताएंगी। कम्युनिटी एम्बेसडर वाला जो आप काम कर रही है, जिसमें आप आसपास की अब जो बहनें हैं उनको भी आप क्या मैसेज देती हैं?
मैं उनको यही मैसेज देती हूँ कि अपने बच्चों को आप अपने साथ ही रखें, और जैसे भी हो, जिस तरीके से मैंने मेहनत की है उस तरीके से आप सब भी मेहनत कर सकते हैं। ये जरूरी नहीं है कि आपको एकदम से हर चीज पूरा हो जाए। हर चीज आप जो भी सोचो अपने बच्चों के लिए या खुद के लिए, हर जरूरतें पूरी हो जाती है, ऐसा नहीं होता है। आपको मेहनत करनी पड़ती है और आपको छोटी छोटी चीजों को जुटाने में बहुत मेहनत करनी पड़ती है, भागदौड़ करनी पड़ती है, उनके पीछे आपको 4 लोगों से बात करनी पड़ती है। कहीं पे आपको वो चीजें मिलती हैं और कहीं पे आपको नाउमीदी मिलती है, लेकिन ऐसा नहीं है कि आप थक के बैठ जाओ। आपको हमेशा कोशिश करनी होती है। जब तक कोशिश नहीं करोगे आप कामयाब नहीं होगे। इसलिए मैं हर किसी से कहती हूँ कि अपने बच्चों को आप कभी भी या खुद को भी इतना वीक मत करो कि आप कुछ नहीं कर सकते। हमेशा आप लड़ो चीजों से, मुश्किलों से, और कोशिश करते रहो कि आप और आसपास के लोगों को भी मैं समझाती हूँ कि ऐसा आप बिल्कुल भी मत करो। मैं भी आपकी कम्युनिटी में रहती हूँ और आप लोगों ने सबने मुझे देखा है मैं कैसे रहती हूँ और कैसे अपने बच्चों को देखभाल करती हूँ। ऐसा नहीं कि हम अच्छा ही महंगा ही चीज लेके आएंगे तो ही हमारा गुजारा है, ऐसा नहीं है। हम छोटी छोटी चीजों से भी अपना गुजारा कर सकते हैं, अपनी जरूरतों को पूरा कर सकते हैं।
Thank you, Shamima. We'll move to the next speaker. We have Salim Bhai with us, जो हमारे कम्युनिटी में प्रधान हैं। तो जब हम शुरू में कम्युनिटी जाते थे, हमारे फील्ड वर्कर्स, केस मैनेजर्स, सोशल वर्कर्स, काफी चैलेंजेस थे उनको, क्योंकि अनजान जगह था, हम कभी वहां पे पहले काम नहीं किए थे। सलीम भाई वहां पे बहुत हेल्प किया इन्होंने, क्योंकि ये वहीं रहते हैं, वहां लोग इनको पहचानते हैं, तो इन्होंने हमें बहुत छोटी छोटी चीजें वहां पे बताई, सिखाई। तो सलीम भाई थोड़ा सा अगर आप शेयर कर पाए, अगर आप यहाँ आना चाहते हैं आप यहाँ आ जाइए। तो अगर आप शेयर कर पाए सलीम भाई की क्या चैलेंजेस होते जो आपने देखे हैं अपने कम्युनिटीज में, स्पेशली क्योंकि जिस कम्युनिटी में सलीम भाई काम करते हैं अपने कम्युनिटी मेंबर्स के लिए, वो बहुत ही अर्बन स्लम के जो सिंड्रोम्स होते हैं हम वो देख पाते हैं। थ्रेट टू एविक्शन है, टॉयलेट फैसिलिटीज नहीं है, जैसे किरण मैम के प्रेजेंटेशन में भी आपने देखा, बेसिक ड्रिंकिंग वाटर नहीं मिलता है परिवारों को। तो सलीम भाई सारे जो ये मुश्किलें हैं उनको सॉल्व करने की कोशिश करते हैं कम्युनिटी लेवल पे। तो आप क्या चैलेंजेस देखते हैं कम्युनिटी में जिसके वजह से आपको लगता है कि परिवार से बच्चा बिछड़ जाता है, और हम क्या कर सकते हैं मिलके जिससे कि हम सभी बच्चों को परिवार में ही रखें?
नमस्कार, मैं सलीम, इंदिरा कैंप जुगी के प्रधान। सबसे ज्यादा कठिनाई परेशानी हमारे कैंप के अंदर ही होता है। कोई टाइम था जो हमारा सलम बस्ती को तोड़ दी गई थी, वहां पे शौचालय नहीं था, सब लेडीज हमारे पटरी पे जाया करते थे। बिजली पानी बहुत दिक्कत थी, और हम तो बचपन से उस जगह पे रह, जो कठिनाई हमें बारीकी से हमें अच्छी तरह मालूम है कि कठिनाई होती क्या है, कैंप के अंदर क्या क्या परेशानी है। वहाँ पे पानी लाया, बिजली लाया, शौचालय बनवाया, बच्चों को आंगनबाड़ी में भिजवा के पढ़वाया, इंजॉय से मिला। कोरोना काल में इतना परेशानी हुई, हर इंजॉय से हमने कुछ न कुछ में दान पुण्य, जैसे खाना बांटना, राशन, सूखा राशन दिलवाना। हमने पार्टी पॉलिटिक्स नहीं देखा, हमने सामाजिक सेवा किया और हर कैंप वाले को जागरूक किया कि 2 रोटी कम खाओ, अपने बच्चों को स्कूल जरूर भेजो। शिक्षा ही सबसे बड़ा हमारा महत्व है, और हम शिक्षा बच्चों को नहीं दे पाएंगे तो हम सलब में जैसे अभी तक सर रहे हैं और हमेशा ऐसे सड़ते रहेंगे। इसलिए बच्चों को शिक्षा देना बहुत जरूरी है। इसलिए हमने समाज को, सेवा को यही कहा कि पार्टी पॉलिटिक्स मत करो, जाति धर्म मत करो, आपस में मिलजुल के एंजॉय के साथ मिलके ये ऐसा अच्छा काम करो जो हमें आज इस मंच पे बोलने का मौका मिला है, ऐसे औरों को भी मौका मिले और उसमें नहीं घुस गए। उदयन केयर को मैं इसको धन्यवाद करता हूँ, इन्होंने बहुत हमें मदद किया और हमें सुझाया समझाया कि आप भी आगे बढ़ो, हम मिलकर हम समाज सेवा करेंगे। जय हिंद।
Thank you, Salim Bhai. A quick translation. So Salim Bhai is sharing that in the communities, the urban slums, that he's helping families meet their basic needs. The threat of eviction is there. COVID has further, aggravated the conditions. And Salim Bhai is appealing that we should move beyond party politics and be able to focus on education for all children, so that children go to school and are able to break the cycle of poverty. So thank you, Salim Bhai. हम आगे चलेंगे और मैं पूजा को इनवाइट करना चाहूंगी। पूजा हमारे कम्युनिटी में बहुत स्ट्रॉन्ग कम्युनिटी एम्बेसडर हैं। इनफैक्ट जब बच्चों ने हमें शुरू में बताया कि हम जब सीसीआई में रहते थे तो हम वहाँ पे आर्ट एंड क्राफ्ट करते थे, हमको वहाँ पे ट्यूशन, बहुत एक स्केड्यूल्ड हमारा रूटीन होता था रोज का। जब हम वापस अपने परिवारों में आए हैं, कोई होता ही नहीं है, मम्मा पापा काम पे चले जाते हैं, हम दिन भर इधर उधर घूमते रहते हैं, कोई गाइड करने वाला नहीं होता है। हम अपने आर्ट एंड क्राफ्ट के स्किल जो क्लासेस होते थे उसको भी मिस करते हैं। तो हमने जगह ढूंढना शुरू किया कि हम कहाँ पे बच्चों के साथ बैठ के कुछ एक्टिविटीज कर सकते हैं, कुछ आर्ट एंड क्राफ्ट भी कर सकते हैं। जगह तो कम्युनिटी में मिला नहीं, बट पूजा सामने आई और इन्होंने अपने घर के छत के ऊपर या घर के अंदर भी इन्होंने हमें परमिशन दिया कि आप कभी भी कोई मीटिंग करना चाहती हैं, बच्चों को बुला के वहां पे आर्ट एंड क्राफ्ट क्लासेस करवाना चाहती हैं या ट्यूशन क्लासेस करवाना चाहती हैं, तो आप मेरे घर को यूज कर सकती हैं। तब से आई थिंक हर एक्टिविटी जो कम्युनिटी में हो रहा है वो पूजा मैम के घर के छत पे हम लोग करते हैं। एंड वी आर रियली थैंकफुल पूजा फॉर ऑफरिंग दैट हेल्प। तो प्लीज आप बताइए, टॉक अबाउट योर पैशन। शी इज वेरी पैशनेट ऑफ वर्किंग फॉर चिल्ड्रन एंड वुमेन इन द कम्युनिटी, एंड अ लिटिल फोकस पूजा कि हम कैसे जो बच्चों को परिवार में रखना है, स्पेशली जो बच्चे इंस्टीट्यूशंस का एक्सपीरियंस ले चुके हैं, उनको हम दोबारा बिछड़ने से रोक पाए, और बाकी जो बच्चे हैं जो एक कागार पे हैं कि वो बिछड़ जाएंगे, उनके लिए हम क्या कर सकते हैं।
Thank you so much for this opportunity. I am Pooja Yadav. I am community leader of हरिजन बस्ती। वो एक स्लम एरिया है, तो वहाँ पर क्या होता है, ज्यादातर जो पेरेंट्स होते हैं वहाँ पर मेनली प्रॉब्लम एजुकेशन की होती है। और थैंक्स टू उद्यान केयर वाले यहाँ पर आके इतना अच्छा काम कर रहे हैं। उन्होंने आधे पेरेंट्स को इतना कन्विंस कर लिया कि वो अपने बच्चों को उनसे दूर ना जाने दे। मैं अपने पैशन की बात करती हूँ, मैं काफी टाइम से अपने कम्युनिटी में काम करती हूँ। मैंने काफी बच्चों को पढ़ाया, ट्यूशन देती थी मैं पहले बच्चों को। वो क्या है, मैंने जो वुमेन सिग्नेचर नहीं कर पाती थी, जो अंगूठा लगाती थी, मैंने उनको सिग्नेचर करना सिखाया है। और ऐसे ही मैं धीरे धीरे काम करते करते, काफी कम्युनिटी में प्रॉब्लम आती है, सिंगल मदर्स हैं जो अपने बच्चों को ठीक से दूर करना चाहती है, मतलब कि वो इतना नहीं कर सकती उनके लिए। इसलिए मैं यही चाहती हूँ कि उद्यान केयर वाले जो हमारी कम्युनिटी में आके जो काम कर रहे हैं, एक एक घर में जाके सबसे मिलना, ट्यूशन क्लासेस देना, आर्ट एंड क्राफ्ट करवाना, जिन बच्चों के पास खुद के लिए टाइम नहीं होता उनको बताना कि आप लोग भी आगे चल के कुछ ना कुछ कर सकते हैं। क्योंकि मेनली हमारे जो हरिजन कैंप बस्ती है वहां पर ज्यादातर बच्चे पढ़ते ही नहीं है। जो 9th के बाद जो बच्चे फेल हो जाते हैं, क्योंकि आपको पता होगा 9th एक ऐसी क्लास है जहाँ पर सरकारी के बाद बच्चे फेल हो जाते हैं, तो उनका क्या होता है कि 9th के बाद फेल हो गए, चलो अब घर पे रहो, क्योंकि पेरेंट्स भी अपने काम पे ध्यान देते हैं। क्योंकि जो फादर होते हैं, फादर ही एक होते हैं कि जो इनकम के बेस पे जो काम करते हैं, तो उनकी वजह से क्या है, फादर वहां काम कर रहे हैं, मदर घर पे काम कर रही है, तो बच्चे इधर उधर पे, और फिर उनका यही होता है कि वो गलत कामों में चले जाते हैं। तो उद्यान केयर की हेल्प से हमारे पे बच्चे पढ़ाई पे ध्यान दे रहे हैं, और काफी ऐसी आर्ट एंड क्राफ्ट एक्टिविटी हैं जो हमारे यहाँ पर होती रहती है उद्यान केयर की वजह से। तो मैं चाहती हूँ ऐसी एनजीओ हमारे पे काम करते रहे। थैंक यू सो मच मैम।
थैंक यू पूजा। we'll now listen to देवयानी। देवयानी एक आंगनवाड़ी वर्कर हैं जो लोधी रोड के सेंटर को संभालती हैं। 3 साल से ये आंगनवाड़ी काम कर रही हैं, और इन्होंने भी प्रोजेक्ट में बहुत आगे आके इन्होंने अपने ड्यूटी, रोल, रिस्पॉन्सिबिलिटी, टाइम कभी भी नहीं देखा, और कोई भी सपोर्ट टीम को कभी भी चाहिए होता है तो ये हमेशा सबसे आगे रहती हैं। तो दिव्यानी, आप शेयर करना चाहेंगी कि किस तरीके से जब हम बाल सुरक्षा के मुद्दों पे काम करते हैं, और आप क्योंकि हेल्थ डिपार्टमेंट से एसोसिएटेड हैं, तो किस तरीके से एक पार्टनरशिप आप देख पाती हैं, डिफरेंट लोग जो कम्युनिटी में काम करते हैं कैसे साथ मिलके वो काम कर सकते हैं।
जी, गुड मॉर्निंग एवरीबॉडी। आई एम देवयानी फ्रॉम WCD डिपार्टमेंट, वर्कर हूँ मैं।
मैं लास्ट 3 ईयर से यहाँ रायसीना झुग्गियों में आंगनबाड़ी सेंटर चला रही हूँ। यहाँ पे हमारा डिपार्टमेंट भी इन्हीं ऐसे जरूरतमंद लोगों के लिए, बच्चों के लिए काम करता है। जैसे प्रेग्नेंट से लेकर 6 ईयर तक के जो बच्चे होते हैं उन पे काम करता है। और हमारे 500 पॉइंट्स अगर मैं गिनवाऊँ तो काफी लंबी लिस्ट हो जाएगी, लेकिन मैं शॉर्टकट में बताती हूँ कि हम लोग ऐसे ही जरूरतमंद बच्चों के लिए, महिलाओं के लिए काम करते हैं और उन्हें काफी सुविधाएं देते हैं। जैसे प्रेग्नेंट वुमेन्स होती है उनको जैसे फर्स्ट बेबी पर जैसे PMVY के फॉर्म की सुविधा, और मान लो उन्हें पोषाहार वगैरह, और 3 to 6 ईयर्स के जो बच्चे होते हैं उन्हें एजुकेशन वगैरह, प्री क्लास वगैरह सब देते हैं। और बाकी जो बीच के एजेस के बच्चे होते हैं उन्हें मतलब पोषाहार वगैरह सब दिया जाता है, और इम्यूनाइजेशन वगैरह होता है, और टाइम टू टाइम पोलियो वगैरह काफी चीजें इन्हें प्रोवाइड की जाती है। तो इन्हीं काम के सिलसिले में अक्सर मैं डेली 4 विजिट करती हूँ, एरिया में जाती हूँ। और मैंने अक्सर देखा है कि यहाँ पे ना लेडीज से थोड़ा सा मतलब परेशान सी रहती है। कई दफे लेडीज से मुझसे खुद कहती है, मैडम हमें रोजगार दिलवा दीजिए, आंगनबाड़ी में दिलवा दीजिए। तो देखो इतना पॉसिबल तो होता नहीं है, क्योंकि आजकल तो आंगनबाड़ी में भी एजुकेटेड लड़कियां मांगते हैं, तो और यहाँ महिलाएं भी थोड़ी कम पढ़ी लिखी हैं। तो मैं जब इन लेडीजों से मिलती हूँ, परिवार से मिलती हूँ, तो मुझे ऐसे लगता है यहाँ नीडी लोग ज्यादा है और यहाँ हमें कोऑपरेट करना चाहिए इन्हें। तो फिर मैं उन्हें कहती हूँ चलो आप, फिर हमारे यहाँ पर भी जैसे NGO की तरफ से भी आते हैं, अलविरा मैम आती हैं, अक्सर मैंने देखा अलविरा मैम आती है, विनीता मैम आती है, राजा सर आते हैं, ये अक्सर विजिट करते रहते हैं और ये काफी कोऑपरेट करते हैं। कभी सर्वे के लिए आते हैं, कभी मतलब प्रॉब्लम, इनकी एरिया की प्रॉब्लम्स को डिस्कस करने के लिए आते हैं, काफी मतलब अक्सर आते रहते हैं। और कई दफा ये मतलब कि डिस्ट्रीब्यूशन भी करते हैं, जैसे बैगर्स वगैरह ये भी मतलब की करते हैं। तो मैं चाहती हूँ कि अगर हम और आप मिलकर इनके लिए कर दें तो मतलब कि, और मेरा ये एक मेरे मन में भी आता है कि जहाँ ये लेडीज है, जैसे यहाँ के कुछ लोग हैं, ज्यादा तो नहीं है लेकिन कुछ लोग ऐसे होते हैं जो अल्कोहल लेते हैं। अगर वो अल्कोहल लेंगे तो उन लोगों का मतलब कि घर नहीं चल सकता, परेशान होंगे, बीवी परेशान होंगी, बच्चे परेशान होंगे। तो मैं चाहती हूँ, और कुछ लोग ऐसे हो जिनकी परमानेंट जॉब नहीं है, कुछ टाइम के लिए वो जॉब पर जाते हैं और कुछ टाइम के लिए घर में रहते हैं, तो उनको गुजारा कैसे होगा? उनका गुजारा क्या, बच्चों का फ्यूचर क्या होगा? बच्चों को खाना नहीं मिलेगा, वो फिर मतलब कि कुपोषण में आ जाएंगे, उन्हें शिक्षा नहीं मिल पाएगी, तो क्या? तो मेरे में मन में करता है कि मतलब कि इन जो लेडीज हैं, मान लो कभी कभी जैसे जेंट्स को जॉब नहीं मिलती है, वो जॉबलेस हो जाते हैं, तो उनको ना कुछ सिखाना चाहिए, लेडीजों को कुछ ट्रेन करना चाहिए, ताकि मतलब कि, और ट्रेनिंग भी ऐसी देनी चाहिए कि वो नियर बाई, अपने एरिया के नियर बाई मतलब कुछ सीख कर शॉप चला सके और बच्चों के टच में रहे। इमरजेंसी पड़ने पे वो बच्चे तक पहुंच जाए और बच्चा उन तक पहुंच जाए। कुछ भी इमरजेंसी होती है, देखो बच्चों के साथ कुछ भी इमरजेंसी हो सकती है, बच्चा बीमार हो जाए अचानक, या कुछ ऐसा हो जाए, बच्चा इधर उधर मिस हो जाता, मतलब तुरंत बच्चे तक पहुंच जाए मम्मी। तो मैं चाहती हूँ यहाँ की लेडीजों को कुछ ऐसे रोजगार सिखाए जाए, तो मतलब आसपास वो अपनी शॉप, छोटी शॉप खोल सके और अपना गुजारा कर सके। और जैसे बच्चों को फिर, अगर मान लो मम्मी अर्निंग करेगी तो बच्चों को पोषाहार मिलेगा अच्छा सा, मतलब कि उनका विकास भी अच्छा होगा, और बच्चे पढ़ेंगे लिखेंगे, और हमारे ये कल के फ्यूचर भविष्य हैं बच्चे, इनको पालन पोषण अच्छा होगा तो काफी बहुत अच्छा हो जाएगा। और मैं चाहती हूँ कि मतलब कि हम लोग भी और आप लोग भी मिलकर इस पर अच्छा काम करें, कदम से कदम बढ़ाकर। मैं भी मैम का धन्यवाद करना चाहूंगी जो इन्होंने मुझे इनवाइट करा यहाँ पे, अलविरा मैम का और विनीता मैम का मतलब धन्यवाद करना चाहूंगी, उन्होंने मुझे इन्वाइट करा, मुझे बहुत अच्छा लगा कि मैं यहाँ प्रेजेंट हुई। थैंक यू वेरी मच।
Thank you, Devyani. I think I must mention here that as part of the initiative, we are trying कि हम हर stakeholder को periodically एक platform पे लेके आ पाए। तो हम साउथ डिस्ट्रिक्ट में अभी 3 स्टेक होल्डर मीटिंग कर चुके हैं, जिसमें जितने भी आपको साथी यहाँ मंच पे दिख रहे हैं, दे ऑल हैव वेरी एक्टिवली पार्टिसिपेटेड। हम अपनी बात शेयर करते हैं, कैसे एक दूसरे को हम मजबूत कर सकते हैं, इस पे काफी चर्चाएं होती है वहां पे। दिव्यानी ने अल्कोहलिज्म का इशू को फ्लैग किया है। शी इज ऑल्सो सेड दैट इन क्राइसिस सिचुएशंस इट्स वेरी इंपॉर्टेंट दैट देयर आर mechanisms and systems so that the children in difficult circumstances can be supported. And she's also made an appeal that we need to work on livelihood schemes for illiterate mothers, single parents, so that they can start earning, supporting their families, which is more community based. They don't have to go too far from their homes. We also had invited, the vice principal of one of the neighborhood schools in that area, but she's not been able to join us. But I'm happy to say that she sent her representatives. Santosh ji and Vijender ji hain hamare saath. They're not prepared to speak, but at least we are happy कि वो हैं और वो हमारे साथ सुन पा रहे हैं, समझ पा रहे हैं चीजों को। और सर्वोदय विद्यालय है अलीगंज में, ये वहां पे शिक्षक हैं। सो थैंक यू फॉर कमिंग एटलीस्ट सर। एंड एजुकेशन, आई थिंक स्कूल्स का बहुत इंपॉर्टेंट रोल हम देखते हैं इन सब कामों में। विद दिस आई विल मूव टू इनवाइट वैदेही मैम। वैदेही मैम को हम सब जानते हैं, शी नीड्स नो इंट्रोडक्शन। शी इज नाउ द चेयरपर्सन ऑफ द चाइल्ड वेलफेयर कमिटी लाजपत नगर साउथ डिस्ट्रिक्ट। और वैदेही मैम बहुत आई वुड से अपने रोल एंड रिस्पॉन्सिबिलिटी के बियॉन्ड जाके सपोर्ट करती हैं, बिकॉज चिल्ड्रन ऑलवेज इज इन द सेंटर ऑफ अ माइंड। सो ओवर टू यू मैम।
Good morning, everyone. And thank you for inviting Udayan. And Mr. Anurag Kunda said in the morning, no need to thank the government bodies. I'm also paid for my job. I want to reiterate that. This fit person concept is my concept, I would say. Let me tell you a small personal story of mine. I have now shared in a big platform like this. I'm a posthumous child and I have 7 siblings. My mother became widow at the age of 32 with 7 children and 1 in the pipeline. She has to go to deliver the baby, me. That was our story. But all are now well placed and we are all educated. We never had any resources at that time. My father was working in the telephone industries. But those days, the postal was different, telecommunication was different. It was reunited later as P&T department. So my eldest sister was 16 years and I am about to come out to this world. Maybe we didn't have any CCIs in those days. Thanks to extended family, thanks to my mom for keeping us together. Of course, she was devastated at that time. She was also in depression. She has given one child to one uncle. We never had any Yadon Ki Barat song to reunite. After 1 or 1.5 years, I met my other sister, and vaguely I remember it. But within a short span, my mother encouraged her complete things. My elder sister was given a job of my father, and we started living together. So I have a great passion for family because I see many children coming into child welfare committee, and your findings also says most of them are single parent. I always think how my mother has managed. Why can't the mothers here before us manage? That time also the poverty was there. Now also is a poverty. But what is that lacking with the single parent system? And the findings also shows the children who are staying in the long-term institutional care, they are not able to reintegrate properly. I admire Udayan Care, sending them children to Tagore International, modern international schools, sending them abroad. Puja is before us. But are we able to go back to the same family in that same environment? The children are speaking English. They are given a very good atmosphere. Dr. Kiran has dreamed that children could get social facilities that I must provide. But that also I feel as a minus point. When I was in 2014 in Child Welfare Committee, I had a talk with Dr. Kiran also that give them the reality, give them the needs of even education institutions of government school, maybe an English medium, so that the reintegration would be in a better position. But going back to your studies and the research, what you have found. This was in COVID time. that we need to send the children for childcare from childcare institutions to the family. It was a conscious decision. And I remember that we worked with Umidaman Gar at Kutup Institution Asia. But we have also consciously taken the decision of sending the children back to the family after the children have lived a considerable year of time, maybe 5 years or 7 years. And also we have seen the age group of above 16 years or above 15 years. That exactly your studies also shows the most children who have been sent during the COVID period was above 15 years and 16 years. So that was a conscious decision by the Child Welfare Committee. But we have done 1 or 2 follow-ups only by the welfare of the same institution. Maybe they also had pressure. Maybe we didn't reach up with another body, whether those children have really reunited with the family, have they continuing their education, or have they following up the discipline at home, or what are they? Have they been migrated? We never had any such resources mapping or anything. That was our fault, of course, I agree. And when Udyan Care has come out with that, so many children who have gone out of these institutions, they are not doing well. Again, we reopened the file. Again, we start working them. Again, we have done the social investigation report. In few children, it was absolute necessary to bring them back into childcare institution. Very few instances. Otherwise, Udyan has been supporting them, and there are testimonies sitting before us. They're also giving their the actual picture of the story also. So, in juvenile justice system, we all think of only childcare institution. All the child welfare committees definitely work on alternative system of foster care, fit person, fit facility, group foster care. I can say we are not working. As CWCs, we have to work and we must strengthen the alternate care apart from childcare institutions, because that can really work in the deinstitutionalization of children. Because as a child welfare committee in South, when I joined, I worked on foster care. Finding a family is definitely a problem, but we have to talk. We must engage with many people. We must initiate dialogue, because it's a new concept, unlike Western. Because in Western countries, they know a foster care in a better way. And the state is also supporting there. Here, we don't give any support from the state. We only insist the family has to take care of the child, right? So there are a lot of families who have come forward due to due process of District Child Protection Unit home visit and follow up many things. We did place many children, and we are still following with the children. They are coming. As CWCs, I think we must work wherever it is possible. Mr. Kundu was telling there are extreme situations where only the children come into childcare institutions, but the JJ system has provided for alternate care. Even those children who have come in the abandoned situation or incapacitated parents, we must explore more foster care in our system. So that can give a family environment, a family culture, a child who can fall back after the 18 years also. This is my humble request. So in a personal capacity, I engage with many young couples who they have already one child. We ask them, you need a family to complete 2 children, but why don't you go for foster care of 1 child? And that also we have not experimented. By God's grace, we got it. We have placed 2 families. One, they have their own child, and we have given 1 foster care child. So they are growing in a very beautiful, one calling Bhaiya and one calling Didi. One is a elder child and one is a younger child. So as citizens, as all of you, you need to take this message forward and talk in their own personal cycle and in your family circle. I think we must work on foster care. And coming to fit person also, the many children who come into sexual abuse cases, who are also stagnated in the childcare institutions. In incest cases, we have no alternative except to keep the child in the childcare institutions. Because we think the father is a criminal, he is in the jail, or chacha, whoever is an incest case, I'm telling you. But there also, as CWC, we must work. The father is in judicial custody only. Why not we send the child to the family? Why the child should miss the family? Why the child should stay in the institutional care? Because we are not working for prosecution. We are working for care, need, and protection. In that case, we must be able to strengthen the family to give it them, because he is a economic the father is a breadwinner. When he is in the jail, the family is devastated. So naturally, those children also coming into system and staying in the childcare institution. So we must develop a system of creating livelihood for those mothers. Those mothers should be empowered. Then we must be able to counsel those mothers to accept the child, because I don't want the child to be blamed. I don't want child to have any honor killing or anything. We must see, I'm not telling straight jacket formula. There are a lot of dynamism in each and every case. The same child will also have many repercussions. Soon after the incident will be something mental status. After 2-3 months of staying in childcare institution, the child will have a different perspectives. As CWC, as CCI, we must constantly work with the families and reunite those children also who are coming into sexual abuse categories. They need to also be reunited with the family, apart from long-term children who are staying in the institutional care. Thank you, sir. Yeah. The next point I see, I have been in the child system for more than 8-9 years now. I'm very sorry, the mother is also here. After keeping the children in the institution for long-term care, the family responsibility is being vanished. They say children are staying in the long distance. We CWC have to have constant dialogue between the family, not only during annual renewing of the term or anything. We must try to work for reintegration at every QPR level also. Because I see many parents, the CNCP categories coming in that they are not able to discipline their child, especially the adolescent children. So they try to go away from family. 363 is then they are produced before the Child Welfare Committee. In the initial, the parents are not accepting the child. The child also does not want to go with the family. Then the chunk of children who are staying in the childcare institution is now becoming those children who are away during adolescent stage, staying in the childcare institution. And those parents, they don't know how to discipline the child, or they don't want to take the child back also. Once we declare them as child in need of care and protection in the system, we are not able to do away with that. Because I remember a case, the child has come into POCSO. The child we have declared has a CNCP category. Whereas the case is finished, the accused is also acquitted because it's no more a problem in the case. It's a false case. But I'm not able to send the child out of the childcare institution because I have declared the child as CNCP. The family responsibility is almost nil. The child is also wants to stay only in institution care. So that is a problem even for Child Welfare Committee. So I always, in our Child Welfare Committee, we say, so before keeping the child in the childcare institution, that's keeping the JJ system. The gatekeeping of JJ system is very important, in my opinion, because the family responsibility, definitely CWC or DCP cannot do it. It is only responsibility of the family, and that has to be invested, that has to be reinforced when the parents are produced before the committee also. I think I'm taking a lot of time. So the one solution for the single parent or poverty, many things, the sponsorship should be strengthened. If the sponsorship schemes given in the Mission Vatsalya scheme is being strengthened, and more, we can send the children back to the families and do follow-up and things like that, the children can be reunited very well. Thank you.
Thank you, ma'am, for giving us so much of hope. And I'm sure, I'm very confident that in the times to come, we are going to work on more sponsorships. We are going to identify more foster carers and keep children in families with your support. I will call upon Varun sir now. Varun sir is the DCPO South District, Delhi. He's a MSW and has been working on child protection issues in Delhi since 2017 now. I'll request you, sir, to please speak a little bit about non-institutional care and what's happening in Delhi and how can we, really work together to keep children in families.
Okay, thank you so much for Udyan Care for inviting me and giving me the opportunity to speak here. I am Varun Yadav, District Chairperson Officer, District South in Department WCD. When we talk about the institutional care, like the word is the child care institutions. So the word, the middle, the care is very important. कहीं हमें ऐसा ना हो कि चाइल्ड केयर इंस्टीट्यूशन है वो कहीं चाइल्ड कीपिंग इंस्टीट्यूशन तो नहीं है, सिर्फ एक बस हमने बच्चे को वहां पे प्लेस किया हुआ है. तो केयर इज वर्ड इज वेरी इंपॉर्टेंट और केयर इज अ वेरी ब्रॉड टर्म. इट टेक अ सो मच सेंसिटिविटी. तो जो मेरा कुछ एक्सपीरियंस रहा है पिछले 5 साल के अंदर में, चाइल्ड केयर इंस्टीट्यूशन में सब कुछ है, पूरा इंस्टीट्यूशनलाइज्ड है, स्ट्रक्चर्ड है, सारा स्टाफ है, बच्चा है, बट थिंग इज दैट वो फीलिंग इज मिसिंग. सो दैट इज रिक्वायर्ड इन फैमिली. तो फैमिली का रिप्लेसमेंट तो कंप्लीटली नहीं हो सकता, बट ये है कि हाँ एक अल्टरनेट, मतलब फैमिली का एक अल्टरनेट दिया गया है. तो जहाँ पे हमारा चाइल्ड केयर इंस्टीट्यूशंस का नंबर बहुत ज़्यादा है किसी भी स्टेट में, तो आई थिंक वो लगता है वो सारी स्टेट कहीं ना कहीं एक फेलियर ही दर्शाता है ना. अगर हमारी फैमिली स्ट्रेंथन होगी तो एक उसके साथ ही साथ में कई सारी चीज़ें, अलाइड चीज़ें हैं जो प्रॉब्लम भी रिड्यूस होंगी. For example, like child begging, child labor, these all are the problems are associated with the family strengthening. Why the child is involved in child begging and child labor? Just because of that, the issue of the poverty, the family is not strengthened as much. That's why they are on street situations. This is the big issue. So, and जब बच्चा child care institutions में आया, और एक जो इम्पोर्टेंट चीज है वो ये है कि जब हमने कितना समय उसको बच्चे को वहाँ पे इंस्टीट्यूशन में दिया है, लाइक वो 2 साल रहा, 3 साल रहा, 4 साल रहा, देन आफ्टर जब वो अपने फैमिली में जब इसको रिस्टोर किया गया, रिस्टोरेशन करने के बाद उस वक्त इसकी रिस्पॉन्स वो क्या किस तरह का प्रोडक्ट निकला, दिस इज द इम्पोर्टेंट थिंग. वो क्या एक सर्वाइवल मोड में है या उस फैमिली को एक नेक्स्ट लेवल में ले जाने की कंडीशन में है, वो सीखा उसने उतने दौरान चाइल्ड केयर इंस्टीट्यूशन में. तो उसकी भी इम्पोर्टेंट उतनी ही ज़्यादा है. तो हम जब भी चाइल्ड केयर इंस्टीट्यूशन में बच्चा है तो पूरे स्टाफ की, उसे पूरे सिस्टम की रिस्पॉन्सिबिलिटी बनती है कि हम उसको एक नेक्स्ट लेवल तक जाएं. बच्चा जब भी फैमिली में प्लेस हो तो अपने फैमिली को भी नेक्स्ट लेवल तक लेकर के जाए. रिहेबिलिटेशन में क्या होता है कि जब हमने एक बच्चे को हम रिहेबिलिटेट करते हैं तो सच काइंड ऑफ द वोकेशनल कोर्सेज जो एक ट्रेंडी होता है, अगर एक बच्ची है तो वो सिलाई कढ़ाई का काम कर रही है या ब्यूटिशियन का काम कर रही है, दीज आर द ट्रेडिशनल कोर्सेज. हमने एक फ्रेमवर्क सेट किया हुआ है. बच्चा है तो वो इलेक्ट्रिशियन का काम कर रहा है, मैकेनिकल का काम कर रहा है, ये सारी चीज़ें. कंप्यूटर का काम सिखा देंगे तो उसका MS वर्ड, एक्सेल, ये पावर पॉइंट, ये सब कुछ आना सीख गया वो. तो हमने उसको कह दिया कि ये हमने बच्चे को रिहेबिलिटेट कर दिया, बट द सेम टाइम क्या वो इस कॉम्पिटिटिव वर्ल्ड में क्या वो अपने आप को सर्वाइव कर पाएगा आगे चल करके, ये सबसे बड़ा चैलेंज है. वन टाइम हम बहुत ये सोचते हैं कि अच्छा एक बच्चे चलो इस कंडीशन से आया, बैकग्राउंड से आया, उसने चलो 60% मार्क्स अचीव किया, ठीक है, वेरी गुड, 60% मार्क अचीव किया, उसके लिए बहुत ट्रेमेंडस है ये चीज. बट द सेम टाइम द रियलिटी इज दैट फिर वो जिस इन्वायरमेंट में आगे चल के जाएगा, जब वो जॉब हंटिंग में इधर आएगा, तब वो कैसे उसको सर्वाइव कर पाएगा. तो वहां पे हैंड होल्डिंग उस लेवल की रहनी चाहिए. ये बड़ी रिस्पॉन्सिबिलिटी है, ये बहुत बड़ा चैलेंज भी है. ये सबसे बड़ा चैलेंज है उस बच्चे के लिए. 18 साल तक तो चलो हाँ, फिर आफ्टर केयर में उसको 21 तक या और 23 तक कर लिया, देन आफ्टर क्या, और उसके बाद भी कितना परसेंटेज बच्चा उस लेवल तक पहुंच पाएगा. दिस इज द बिग चैलेंज. तो हमारा जो सिस्टम है जो उनको सर्विसेज प्रोवाइड करने का, वो क्या उस लेवल तक का है, दिस इज द बिग चैलेंज. सो ये नॉट ओनली ये रिस्पॉन्सिबिलिटी गवर्नमेंट साइड की भी है, नॉन गवर्नमेंट साइड की भी है. तो हमको सबको कलेक्टिवली इस चीज़ वर्क करना चाहिए. और मैं समझता हूँ जब कलेक्टिव वर्क करेंगे धीमे धीमे, और ये फैमिली स्ट्रेंथनिंग कॉन्सेप्ट है वो ध्यान केयर का, दिस इज अ वेरी गुड कॉन्सेप्ट. फैमिली स्ट्रेंथनिंग होगी तो इस कुछ काफ़ी चीज़ें हद तक सॉर्ट आउट होंगी. सो थैंक यू सो मच. हाँ,
Rajiv sir, I'm so sorry. I think we're running really late and we need to, we'll catch up with this conversation during the tea break. We're really running late. So sorry, sir. But thank you, Varun, sir. Thank you for calling out that collective action is needed and that we need to prepare children and young people for life in order to ensure that they are mainstreamed in society. I'll move on to Seema Naz. Seema Naz teaches at Jamia Millia Islamia, and she's also a consultant with Martin James Foundation. So Seema, quickly in like 2 minutes, if you can talk about the work that Martin James Foundation does, and also your experience over the last 1 year in the Fit Families Together initiative.
Thank you. I'll not take more than 2 minutes. Thank you so much. I've been associated with Martin James Foundation for not for long, but I'm glad and grateful that I'm representing the organization here at this platform. Thank you for inviting. So I'll just brief you about Martin James Foundation, a little bit about the foundation. So it's a global network of organizations working in the field of alternative care. We work through our affiliate organizations. They are known as Key Assets. Key Assets, they are present in several countries in the world, including Canada, Australia, New Zealand, Japan, and Ireland. Through Key Assets, we are doing alternative care, like offering alternative care programs. That's a non-for-profit organization. Apart from Key Assets, we have Foster Talk and Foster Line in the UK. Through Foster Talk and Foster Line, we support foster carers, foster care organizations, and we provide a lot of guidance to them. And we have EPIC. EPIC is a program through which we handhold and support care leavers, young people who are willing and enthusiastic to become entrepreneurs. We support them through funding and mentorship. And we have global programs as well. Through global programs, we are supporting various organizations who are starting and willing to work in the field of alternative care across the globe. And we are supporting few very good organizations. One of them is Udayan Care. And we are supporting organizations in Nepal, Cambodia, Uganda, Madagascar, Indonesia, Thailand. So in brief, this was all about Martin James Foundation. If you wish to know more about it, you can just see the website. So about this program, this FIT program, this is a very, very nice program. And, you know, as a social worker, I'm an academician, I'm a social worker. I've been practicing in the field of alternative care. And this program, you know, during the pandemic, we were working with children and families. And I was already, you know, thinking about what must be happening to the children who are all there in care in institutions. And when an advisory came, and we were all like astonished to see all the children who are in the institutions without, I mean, we did not have time to prepare these children and their families to be together again, and they were sent back haphazardly. But this initiative of Udayan Care, when they approached Martin James Foundation with this proposal to start working with children who have been sent back to their homes and strengthen these families, that was commendable. And in October 2021, Martin James Foundation started working with Udayan Care, and we are already through 1 year, and this is the second phase. And we are very happy to see the outcomes, and we are happy that we are gaining visibility. And they have been, like, Udayan Care has been tremendous. They have, you know, demonstrated their approach and the outcomes, and, you know, their expertise in working in the field of alternative care and children and families is tremendous. And now we have gained visibility, and we are very glad that SERI has come forward, and they are joining this program, and they'll be taking this forward in this next phase. So thank you so much, SERI, Udayan Care, for helping us to make, you know, see our vision clearly. And we are happy to be a part of this initiative. Thank you.
Thank you. Thank you, Seema. And we really look forward to taking the work of MJF and its footprint more stronger in India with your support. Last but not the least, we have Devashish from SERI. SERI joined us in this initiative since October last year. And Devashish is very keen that he explains the 10 domains in the circle of care and protection that we have arrived at so far. in just, a couple of months. So he, I think, is interested to explain this to you. So you have the slide here, Debashish, over to you.
थैंक यू लीना जी। इन 10 डोमेन्स पे जाने से पहले मैं थोड़ा अप्रोच की बात करना चाहूँगा कि इस प्रोजेक्ट की अप्रोच क्या है और हम उसको किस पर्सपेक्टिव में देख रहे हैं। तो जैसे सुबह से अभी तक हम लोग बातचीत कर रहे हैं, हम लोग देख रहे हैं कि बच्चे CCI ना जाएं, इसलिए हम प्रिवेंशन मोड पर एक अप्रोच हम अप्लाई कर रहे हैं। बट मैं ये कहूँगा कि इस प्रोजेक्ट में हम इसकी बड़ी पिक्चर को देख रहे हैं। ये सिर्फ प्रिवेंशन मोड पे जाने के लिए, काम करने के लिए इस प्रोजेक्ट पे हम काम नहीं कर रहे हैं। इस प्रोजेक्ट में हम एक कोशिश कर रहे हैं कि बच्चा अपनी फैमिली के साथ रहे, पहली चीज। दूसरी चीज, एक बच्चे को डेवलपमेंट होने के लिए या उसको आगे बढ़ने के लिए क्या क्या चीजों की जरूरत पड़ सकती है, वो सब चीजें भी उसको मिले। तीसरी चीज कि जो उसके राइट्स हैं वो इंश्योर हो सके। और चौथी सबसे इंपॉर्टेंट चीज है कि बच्चा जो आज किसी पे डिपेंड है, वो आने वाले समय में वो खुद से अपने जीवन के फैसले ले सके, अपने जीवन को आगे बढ़ा सके और दूसरों को भी आगे रास्ता दिखा सके। क्योंकि हम लोग जब भी काम करते हैं किसी प्रोजेक्ट में, तो एक पर्टिकुलर प्रॉब्लम को लेते हैं, उस प्रॉब्लम को दूर करने की कोशिश करते हैं। बट इस प्रोजेक्ट में हमने 360 डिग्री अप्रोच करने की कोशिश की है। मैं नहीं कह रहा हूं कि हम 360 डिग्री कवर कर लेंगे, कर सकते हैं। अगर आज आप में से कोई इसमें कोई सलाह देगा तो हम जरूर उसमें उसको शामिल भी करेंगे। कुछ अगर आपको लगेगा कि इस चीज को भी इसमें शामिल करने की आवश्यकता है तो हम बिल्कुल उसमें शामिल करेंगे। लेकिन मैं इतना कहूंगा कि ये एक हमारा प्रयास है। हमने कोशिश की है कि हम कैसे अपने जो समाज है, अभी जैसे सभी पैनलिस्ट बोल रहे थे और काफी लोग जानते भी हैं कि जो हमारा समाज है उसमें उसकी अपनी एक लिमिट है, जो सिस्टम उसकी भी अपनी एक लिमिट है। सिस्टम में कितने बच्चे CCI के लिए आ रहे हैं, कितने बच्चे CWC में प्रोड्यूस हो रहे हैं, तो वो संख्या भी बहुत तेजी से बढ़ती जा रही है। पॉपुलेशन बढ़ रही तो प्रॉब्लम बढ़ रही है, और प्रॉब्लम बढ़ने के साथ वो नंबर्स भी बढ़ रहे हैं। तो उसको भी रोकने की कोशिश इस प्रोजेक्ट के माध्यम से हम देख रहे हैं कि उसको भी हम कम करेंगे। तो ये पूरा अप्रोच है जो कि न सिर्फ बच्चों को CCI में जाने से रोकने के लिए, बल्कि उन बच्चों को उन पैर पे खड़ा करने के लिए और उनको ऐसा भविष्य का नागरिक बनाने के लिए, न सिर्फ वो अपने जीवन को, अपने परिवार को बेहतर तरीके से चला सके, बल्कि वो दूसरों को भी रास्ता दिखा सके। तो वो इन सब चीजों को कवर करते हुए हम 10 डोमेन्स में जो है उसको कवर करने की कोशिश की, सारे अप्रोचेस को। पहला, अगर हम बात करें बेसिक नीड एंड सेफ्टी, हम सभी जानते हैं कि कोई भी इंसान है तो उसकी जो बेसिक नीड्स है और जो उसकी सेफ्टी का कंसर्न है वो इंश्योर होना चाहिए, वो उसको मिलना चाहिए। वो भोजन हो सकता है, वो शेल्टर हो सकता है, वो कपड़े हो सकते हैं, वो उसका राइट है, वो उसको मिलना चाहिए। तो जो सबसे पहली जरूरी चीज है, जैसे कि एक बच्चा पैदा भी होता है तो सबसे पहले उसको क्या जरूरत होती है? ऑक्सीजन की। फिर उसके बाद उसको जरूरत होती है कुछ फूड की इन फॉर्म ऑफ मिल्क। तो बच्चे जैसे, एक बच्चा जैसे बड़ा होता जाता है उसकी जरूरतें भी वैसे बढ़ती जाती हैं। तो जब हम पैदा होते हैं तो हमारी कुछ जरूरत कुछ होती है, जब हम जैसे से बढ़ते जाते हैं हमारी जरूरतें भी बढ़ती जाती है। तो वो जो साइकिल है, जो वो चेन है, उसको भी हमने इस डोमेन में कवर करने की कोशिश की। और उसमें सबसे पहले जो है, जो मैं अभी बता रहा था कि बेसिक नीड्स एंड सेफ्टी सबसे पहले आता है, कि सबसे पहले बच्चा सेफ हो और उसकी जो बेसिक नीड्स है वो फुलफिल हो सके। सेकेंड चीज है हाउस होल्ड फाइनेंस का। हम लोग बहुत से अप्रोच पे काम करते हैं और जो हम लोग कई बार एक बहुत मिसिंग चीज देखते हैं कि हम कई बार लाइवलीहुड पे तो काम करते हैं कि चलो ठीक है, हमने जैसे अभी शमीमा जी बता रही थी कि उन्होंने जब उदयन केयर से मिली और उदयन केयर के सपोर्ट से उन्होंने अपनी एक चाय की दुकान लगाई और चाय की दुकान के माध्यम से वो अब अपने परिवार को आर्थिक रूप से चलाने में सक्षम हो गई हैं। ठीक है, उन्होंने भी उसको स्वीकार किया कि कुछ चीजें छूट जाती हैं, कुछ कमियां हैं, और ये हम सभी जानते हैं कि कोई भी चीज परफेक्ट नहीं होती है। लेकिन उसमें एक जो सबसे इंपॉर्टेंट चीज है कि ठीक है, हमारी जो आज की जरूरत है वो तो फुलफिल हो ही, उसके लिए तो तुम तैयार हो, लेकिन साथ में हमें उस फाइनेंशियल को कैसे मैनेज करना, मैनेजमेंट जो होता है वो बहुत ही इंपॉर्टेंट है। वो फैमिली को बताने के लिए, उनको सिखाने के लिए बहुत इंपॉर्टेंट है कि कैसे आप आने वाले समय में अगर कोई क्राइसिस आती है तो कैसे अपने आप परिवार को आप जो है सर्वाइव मोड पे ले जा सकते हैं। तो उसके लिए सेविंग, उसके लिए जो दूसरी आवश्यकताएं हैं उस पर फोकस करने की जरूरत है। तीसरा है फिजिकल हेल्थ। इस पे मैं बहुत नहीं जाऊंगा, समय की बात भी है। फिजिकल हेल्थ हम सभी समझते हैं कि कोई डिजीज है, कोई सपोर्ट की जरूरत है, वहां पर उसको, बच्चे को जो सपोर्ट मैकेनिज्म है उनसे कनेक्ट करने की जो कोशिश रहेगी वो हम प्रोवाइड करेंगे। मेंटल हेल्थ, इस पे थोड़ा जरूर कहना चाहूंगा कि अभी भी हमारे भारत में मेंटल हेल्थ को कुछ उसको कंसीडर ही नहीं किया जाता है। मतलब कंसीडर करते, लेकिन अब मेंटल हेल्थ की बात करते तो सोचते हैं कि सामने वाला पागल है। थैंक यू। तो इस टैबू को तोड़ना बहुत जरूरी है, बहुत जरूरी है, क्योंकि जब हम परिवारों से बात करते हैं, लोगों से बात करते हैं, तो वो इसको नेग्लेक्ट करते हैं, और नेग्लेक्ट करने की वजह से क्या होता है कि उनकी दूसरी समस्याएं आ जाती हैं। तो मेंटल हेल्थ को पहले तो एक सामान्य रूप से ले सकें उसकी कोशिश करनी, और साथ ही साथ जैसे हमारे प्रोजेक्ट में 2 काउंसलर हैं, इनकी मदद से, इनकी सहायता से हम कोशिश कर रहे हैं कि उनको हम मेंटली प्रिपेयर करें कि कैसे वो अपने परिवार को अच्छे से चला सके। जैसे शमीमा जी ने बोला कि मेंटली मजबूत होना बहुत ही जरूरी है, तो सुनकर बहुत अच्छा लगा, क्योंकि मेरा भी मानना है कि अगर मानसिक रूप से आप मजबूत हैं तो आप कुछ भी कर सकते हैं, कुछ भी आप अचीव कर सकते हैं। नेक्स्ट है एजुकेशन एंड वोकेशन। इस पे भी मैं बहुत डिटेल में नहीं जाऊंगा समय को देखते हुए। अगर आगे कोई क्वेश्चन होंगे तो मैं ले लूंगा। इसके बाद ओके, थैंक यू। आफ्टर सेशन वी कैन डिस्कस चाइल्ड सेल्फ अवेयरनेस। ये मेरा बहुत फेवरेट डोमेन है, क्योंकि मैंने अपनी लाइफ में जो है बहुत सी प्रॉब्लम्स अपने, जब मैं बच्चा था तो बहुत सी चीजें मैंने देखी, और मैंने अपने आसपास भी देखा। मैं थोड़ा ऑब्जर्व ज्यादा अच्छा कर पाता था, तो मैं अपने लाइफ में भी देखा, मैंने दूसरों की लाइफ में देखा कि हमारे परिवार में या हमारे आसपास इस पे बात ही नहीं की जाती है, बिल्कुल बात नहीं की जाती है। और जब हमारे पास सामने कोई प्रॉब्लम आती है तो हमें पता नहीं होता उस प्रॉब्लम को मैनेज कैसे करना है। मैं आई थिंक 16-17 ईयर्स का जब तक हुआ तब तक मैं अपने इमोशन को कैसे मैनेज करना है मुझे पता ही नहीं था। मुझे वो सबसे बड़ी वीकनेस लगती थी। मैं बहुत इमोशनल हूँ और मुझे वो वीकनेस लगती थी, और आई वाज थिंकिंग कि मैं मतलब भगवान को कोसता था कि आप मतलब मुझे इतना इमोशनल क्यों बना दिए, मैं हमेशा परेशान हो जाता हूँ, फंस जाता हूँ। बट आफ्टर सम टाइम्स, आफ्टर रीडिंग मेनी बुक्स एंड कुछ अच्छे लोगों से मिलने के बाद मुझे रियलाइज हुआ कि नहीं, दिस इज नॉट माई वीकनेस, दिस इज माई स्ट्रेंथ। इसको मुझे अपनी स्ट्रेंथ बनाना होगा, और स्ट्रेंथ कैसे बनाना है फिर उस पर मैंने काम किया। तो अभी हम लोग देखते हैं कि जैसे कोटा में इतने बच्चे एजुकेशन के लिए जाते हैं, सुसाइड इतने बच्चे कर रहे हैं, उन सबका रीजन ही यही है कि वो अपने को जान ही नहीं रहे हैं, सिर्फ अवेयरनेस है ही नहीं। अभी आप सुसाइड का अगर केस देखें तो इंडिया में बहुत ज्यादा है। तो मैं यही शुरू में भी कह रहा था कि इस प्रोजेक्ट के माध्यम से हम ना सिर्फ बच्चों को सीसीआई जाने से रोक रहे हैं, बल्कि हम उनकी बहुत सी समस्याओं को एड्रेस कर रहे हैं और उसको कवर अप करने की कोशिश कर रहे हैं। और इसमें मैं मानता हूं कि ये जो डोमेन है चाइल्ड सेल्फ अवेयरनेस बहुत ही महत्वपूर्ण भूमिका निभाएगा बच्चों को भविष्य के लिए तैयार करने के लिए। नेक्स्ट है कम्युनिटी एंड सोशल कनेक्शंस, दैट इज आल्सो वेरी इंपॉर्टेंट डोमेन। हम लोग कई बार करते हैं कि कोई बच्चे की समस्या आई तो चाइल्ड प्रोटेक्शन एक्सपर्ट के पास जाओ, एनजीओ के पास जाओ, यही तो करते हैं। कोई समस्या आ रही है आप उनसे मिलो, आप उनसे जाओ। हम ऐसा मानते हैं कि ये स्थिति आए ही ना, कम्युनिटी में ही इतनी अवेयरनेस हो, कम्युनिटी के लोग इतना जानकार हो, फैमिली के लोग इतने जानकार हो कि वो उनको पता हो कि अगर ये समस्या आ रही है तो उसका समाधान हमें कैसे निकालना है। उसके लिए उनको किसी की सहायता की जरूरत कम से कम हो तो बेहतर है। तो उस दिशा में काम करने के लिए हम लोग कम्युनिटी एंड सोशल कनेक्शन पर फोकस कर रहे हैं। नो डाउट कि उसमें हमारा प्रिवेंशन मेन ऑब्जेक्टिव है कि बच्चे सीसीआई में जो थे वो दोबारा ना जाएं, या जो ऐसे रिस्क पर हैं कि जो कभी भी सीसीआई में जा सकते हैं तो उनको वहां से रोकने की कोशिश करना है। नेक्स्ट है लीगल इंटाइटलमेंट्स। इस पर भी मैं बहुत डिटेल में नहीं जाऊंगा, हम सभी जानते हैं कि ये क्या होते हैं, इसकी सहायता से हम कैसे परिवार को सशक्त कर सकते हैं। मैं बस एक ही चीज कहूंगा इस पर कि लीगल इंटाइटलमेंट में जब भी मैं बात करता हूँ, मैं एक बात कहता हूँ कि कभी हम जब परिवार के साथ काम करें तो जरूर उनको जो भी हम स्कीम से कनेक्ट करना चाहिए और कोशिश करनी चाहिए, बट साथ ही साथ उनको ये भी बताना चाहिए कि इस पर डिपेंड ना हो। उनको ये भी समझाना चाहिए कि जो भी आपको, चाहे वो वीडियो पेंशन मिल रही है या कोई भी पेंशन मिल रही है, उस पर आप डिपेंड ना हो, और कोशिश करें कि आप अपनी दूसरे अर्निंग सोर्सेस को जो है इसमें लाइए, जिससे कि ये एक तरह से अगर आपकी सेविंग हो सके तो दैट वुड बी मच बेटर। बट हमें पता है कि जो रियलिटी है वो थोड़ा टफ है, बट हमारी एक कोशिश रहेगी इस डोमेन के माध्यम से कि इस दिशा में हम आगे बढ़ सकें। नेक्स्ट है पॉजिटिव पेरेंटिंग। ये भी मेरा बहुत फेवरेट डोमेन है, क्योंकि हम जब भारत में बात करते हैं पॉजिटिव पेरेंटिंग की, तो लोग कहते हैं नहीं हमें तो सब पता है, हमें तो सब जानकार है, हमें सब आता है, और वो उस पर कोई बात ही नहीं करना चाहता है। बट अगर फैक्ट देखा जाए तो हम सब में बहुत सी चीजें हैं जो सीखने की जरूरत है। मैं नहीं कह रहा हूँ कि कोई परफेक्ट या कोई इम्परफेक्ट है, बट बहुत कुछ सीखने की जरूरत है। मैं पिछले 10 सालों से बच्चों के लिए काम कर रहा हूँ और मैं अभी तक सीख रहा हूँ, और मैं सोचता हूँ कि मेरा जब बच्चा होगा तो फिर मैं उसको कैसे पालूंगा, तो वो लर्निंग मेरी अभी तक चल रही है। मैं नहीं कह रहा हूँ कि मैं परफेक्ट हो गया हूँ। तो पॉजिटिव पेरेंटिंग का बहुत स्कोप है, बहुत जरूरी है, और इसमें सबसे इंपॉर्टेंट चीज ये है कि पेरेंट्स समझें कि बच्चे की क्या आवश्यकता है और उसको कैसे फुलफिल करना है, और वो अपने को उसके लिए सक्षम बनाए। लास्ट है होप एंड फेथ। हम सभी जानते हैं कि अगर हम मेंटली प्रिपेयर नहीं है, हमारे माइंड में होप नहीं है, तो हम कुछ भी अचीव नहीं कर सकते हैं। होप ही सबसे बड़ी चीज होती है, जो आई थिंक मैं मानता हूँ कि वही एक चीज होती है जो हमको आगे ले जाती है और हमको दूसरी समस्याओं से दूर करती है। अगर हमारे मन में होप नहीं है तो ये समाज, ये परिवार, हम भी नहीं चल सकते हैं। तो बिना होप के हम आगे नहीं बढ़ सकते हैं। तो होप बहुत ही इंपॉर्टेंट है, और इसका जो महत्व है, जो उसकी इंपॉर्टेंस है, वो कैसे हम फैमिली, बच्चों और कम्युनिटी को समझाएं और कैसे उनको इस दिशा में ले जाएं, उसका प्रयास हम इस डोमेन के माध्यम से करेंगे। थैंक यू।
Thank you, Devashish. I think that was very well explained. Time बिल्कुल नहीं है, so I don't want to get into wrapping up the entire panel discussion. But I just want to say that the expert panel discussion that follows this is definitely going to throw a lot of light into what has already been shared. And I'd like to thank all the panelists for sharing their direct voices. And before I end, I want to call upon Jamadi again, because I love hearing her, to just Jamadi थोड़ा सा share करें यहाँ पे आके कि आपको पूरे discussion से आपको कैसा लगा, where are you, थोड़ा सा quickly 30 seconds, and we'll end this panel discussion.
थैंक यू सो मच मैम, आप लोगों ने मुझे इनवाइट किया है ना, और
इसको नीचे करो।
मैंने सारी चीजें सुनी और मुझे बहुत अच्छा लगा, मैंने समझा। और जैसे भैया ने अभी बताया, मैं नाम भूल गई, थोड़ा सा मुझे दिक्कत है। हाँ, देवाशीष भैया से मैं रिलेट कर सकती हूँ कि मैं भी बहुत ज्यादा इमोशनली हूँ, मैं बहुत ज्यादा इमोशनल हूँ। चीजों को देख के मुझे बहुत ज्यादा मैं इमोशनल हो जाती हूँ, और मुझे लगता है कहीं ना कहीं वो मेरी वीकनेस है। तो मैं अगर जैसे मुझे ज्यादा रोना आता है तो मैं किसी के सामने नहीं रोती, वॉशरूम होता है वहां जाके मैं 1-2 घंटे आराम से रोके बिल्कुल फ्रेश होके आती, ताकि किसी को पता ना चले, कोई मेरी वीकनेस ना जान पाए। पर होता है ना बहुत ज्यादा। बाकी मैंने सारी एक्सपीरियंसेस वगैरह देखा और मुझे पता चला कि मैंने कितनी सारी डिफिकल्टीज वगैरह जो फेस किए, वो कहीं ना कहीं मैंने बहुत अच्छा किया कि उससे हार नहीं मानी, सिचुएशन को फेस किया। क्योंकि सिर्फ और सिर्फ मेरी जिंदगी में नहीं, हर एक इंसान की लाइफ में प्रॉब्लम्स होती है, चाहे वो छोटी हो बड़ी हो, पर हर एक लाइफ इंसान की लाइफ में होती है, और उसे वो फेस करना आना चाहिए। अगर इंसान फेस करना सीखे तो वो हर एक सिचुएशन को फेस कर सकता है अपनी लाइफ में, चाहे वो अपनी हो। और मैंने एक चीज सीखी है कि मैंने इतना ज्यादा बैड एक्सपीरियंसेस फेस किया है, अब मैं किसी को देखती हूँ और कोई मेरे सामने होता है तो मैं उसको सपोर्ट कर पाती हूँ। नॉट मतलब पैसे से नहीं या किसी से नहीं, पर इमोशनली जो सपोर्ट होता है मैं बहुत सारे लोगों को कर पाती हूँ, तो मैं अपने आप से बहुत प्राउड फील करती हूँ। और बाकी आप लोगों ने सुना उसके लिए थैंक यू सो मच।
थैंक यू। और मैं रिक्वेस्ट करूंगी टीम से कि एक छोटा सा गिफ्ट है, तो सभी पैनल मेंबर्स को जल्दी से हम हैंड ओवर करेंगे। सबसे जमादी, द फर्स्ट वन। ग्रेट। वैदेही मैम, प्लीज एक्सेप्ट द। वरुण सर को राजा प्लीज हैंड ओवर करिए। देवाशीष को दे दीजिए थैंक यू गिफ्ट। दिव्यानी को दे दीजिए. दिव्यानी, please accept the. Seema and Salim sir, please accept the. So we'll break for tea now and we'll come back like in 15-20 minutes. Should be starting the next panel. We are really running late. I'll request everyone, please pick up your cup of tea and be back by 12:35. Not later than that. Thank you so much.
मुझे आपके साथ फोटो खिंचवानी है, तो आप आगे रहिए।
You're on.
So my name is Ian Forber. And I'm Mike, and I'm Well, you did a perfect job. As you know.
Yes, you are going to the.
My name is Ian Forber, and I'm the Deputy Executive Director. And we are really grateful for supporting you guys here. You want to say this now? Thank you so much. Yes, yes, and I think this is the. Yeah. One second, to get some milk in the coffee and then. We'll start. Why do you, I'm trying to. You are. Chances are not that really. So, I brought my son. Then I, my son and baby, he became the champion of art. But now we don't think that and then he went to is building on a place, it's not on a it's on
बिल्कुल चलो वाली बात है मेरा दिमाग मेरे को ना बस तो मैं हूँ यहाँ पे मैं भागने वाला हूँ थोड़ी देर में जाने वाला हूँ So please comment.
Everyone, please come inside. Everyone, please come inside. Everyone, please get seated. Everyone, please get seated. Now let's begin with our next panel discussion. It focuses on understanding the different approaches to family strengthening in India. The panel chair is Ms. Sangeeta Bhatia from UNICEF, and I request ma'am to come on the dais. I will also request the esteemed panelists to join the chair on the dais. Ms. Rita Panikkar, Ms. Vijay Lakshmi Arora, Ms. Nicole Menzies. I'm sorry if I've pronounced your name wrong, ma'am. Ms. Sanjay Gupta, Mr. Sanjay Gupta, Ms. Sandhya Mishra, and Ms. Preeti Patkar. Let me introduce the chair before handing it over to her. Sangeeta Bhatia is a senior development sector professional with more than 2 decades of experience in children's rights. She has worked extensively on education and protection of children in several national and international organizations and has managed programs in India and Asia. Sangeeta is currently consulting the UNICEF India on alternative care.
Thank you so much. A very good afternoon to everybody and welcome to this panel discussion. Without much delay, we will start with our panel on family strengthening. And I will request our first speaker, Ms. Rita Panikkar. Almost everybody in this room is aware of Rita. She is the founder of Butterflies. She's an eminent personality in child protection in India. So I will request her to speak a few words about family strengthening in the Indian context. Thank you.
Actually, it was not going to be a few words because I was asked to speak about our reflections and learnings on this whole subject. So that's why I begin with that. I put down some notes. Let me begin by saying that we have analyzed child protection issues through the lens of children in crisis, failing to address the fundamental issues of a family in crisis. That's what it is. Its economic distress and lack of social protection are the key factors that push families to the brink of collapse. The multidimensional poverty is entrenched in structural inequities and inequalities, and we have to look at poverty from that lens, resulting in a section of the society caught in a warp, I would say, of generational illiteracy and poverty. And the children who belong to these communities are the ones who are left behind. And they are the ones who actually need the care and protection. So there is a disconnect between the agencies that are part of the socio-ecological system meant to care and protect children. We work in silos and not as a holistic ecosystem. All the agencies, both CSOs and government, come into action after a family has been dissolved due to multiple factors. It could be economic distress, it could be poor health, it could be violence, it could be caste and ethnic discrimination, it could be lack of documentation and exclusiveness in schools that keep children out of schools. And there are a number of studies that have proven family is the most crucial social unit that needs strengthening, and or if children must grow up to be emotionally well, self-confident, make informed choices, and the ability to resolve conflicts. I just wanted to take a little away from this. The young person who said that I used to go to the washroom and cry for 2 hours because I didn't want others to know my weakness. I want to tell her it's not a weakness. It's your strength. It's your strength when you can cry and you can show your emotions. I think that's a great strength. So don't consider it to be a weakness. And that's what we have been continuously telling boys. And therefore, boys don't cry even if they're emotionally hurting, because it's considered a weakness. Okay, it's a very gendered way of looking at it. So you are a strong person. Now, having said that, I would say that how do we look at family strengthening? There has to be a systems approach, which should also include not only the social welfare, the women's welfare, child welfare, education, health, but it should also include creation of economic assets for the families and communities living below the poverty line. And that's important. So perhaps there is a need to repurpose and upskill existing skills people have in this age of continuous disruptions to meet the market demands of today, to create assets income for themselves. As we see across the country, the huge migration of people that is taking place from one end to the other in search of livelihoods is because the traditional livelihoods has been nowhere supporting them. So we need to repurpose it. I think it's time for us to promote also cooperatives of primary producers. You know, cooperatives are the way forward for the poor, the marginalized communities, families to create assets and wealth. And here I would like to say that, of course, we need funds to give training and also to initiate the cooperatives. But an example from the state of Kerala, Kudumbashree, the self-help group evolved into a Kudumbashree where the women have economic enterprises, but the women are also involved in the local governance. Which means what? They're in the panchayats, they're in the urban wards. They also are part of overseeing the Anganwadis that are working. They are also part of looking at the school systems, the healthcare. So the Kudumbashree, where the women are the ones who are engaging with the local self-government, has really brought in a radical shift in some of these communities which have been marginalized. The other important thing in our years of experience we have realized is household budgeting. We need to teach parents and educate them on budgeting household income and expense. And we have found that household budgeting, I mean, the moment you do that, because in the long run, the poor families need to prioritize their needs and save small part of their earnings, which can grow incrementally and become a safety net in times of crisis, as we had in pandemic. Household budgeting also creates space in the family for mothers and children to be part of the decision making on expenditure and savings. As we all know, the control over money traditionally is in the hands of the fathers, the men. And here, if you do this, the women also have a say, and they have no say in the money, but in this kind of a situation, they will have a say. The second point is emphasizing emotional well-being of children. I mean, I cannot say it enough to emphasize this. It is so very important. The pandemic has actually shown us the importance of mental health in the lives of people. It impacted children and adolescents in several ways, in how they learn, how they play, how they interact, and deal with situations. The classic healthcare interventions have always been in communities related to nutrition, vaccination, inoculation, safe drinking water, and it's more of the emphasis on curative and preventive disease-free healthcare. But mental health has not been part of public healthcare program in most of the countries, including India. Today, we realize the importance of holistic health, including mental health of a poor person. So what do we mean by that? Mental health care should be part of all our work with families and children. The emotional well-being of children is important if the child has to grow up to be a self-confident person and to be taking informed decisions and resolve conflict through dialogue and discussion and not through violence and aggression. The family has to be a caring and protective environment, and therefore, wherever necessary, family therapeutic care interventions should be part of the program, especially in cases of dysfunctional family. So it's not only individual, but you also have to look at the family. A family therapeutic care interventions is crucial for us. The other part is, the next is the schools. The schools are important because they are the caring and protective agency. Schools are an important agency in the lives of children. They play a powerful role in shaping the lives of children. It is an agency that can positively change the lives of children, support them to get out of generational illiteracy and poverty. Retention in schools will prevent children from being trafficked, pushed into exploited labor, and early marriage. The schools play a considerably important role here in preventing this, preventing children from loss of parental care and family care. It is therefore important that data management systems in education departments is improved to keep track of out-of-school children. This will, of course, obviously require budgets and would also need human resource to do that. And if the national laws pertaining to free and compulsory education should be implemented in letter and spirit, if education has to become a reality for children. We have a very good, excellent act, right to education, but it should become a reality for everybody, for all the children. We found that school management committees in schools must make efforts to induct parents belonging to socioeconomic and vulnerable background to the members of the school management committee. And this is part of the RTA Act. But in many schools, you don't have them. Even a family living on the street, but the child is in a formal school, has the right to be in the SMC. And we have to work towards it. What does it do? What it does is that it brings an absolute change in the attitudes of the school management and teachers towards the poor and make them sensitive to the challenges faced by first-generation learners. We have seen that they give special attention, the classroom teaching, learning, and the school itself becomes inclusive environment for all children. Studies have shown inclusive learning environment have prevented children from dropping out of schools. So we need to work towards that. And I would say that we also, as civil society organization, we need to do vulnerable mapping in the community to see how many children are out of school and how can we re-enroll them into schools, along with the local self-government, but also with the government. I think that is imperative. The pedagogy of teaching may have to be reviewed, and new skills imparted to the teachers, especially on the use of technology and online teaching, and for them to be aware of the dark web sites and of the online sexual abuse that takes place. So that becomes important that they are also trained. I'm going to finish, don't worry. The other is providing midday meals is another very important thing, because the midday meal is a singularly most important social protection program for children from the poor marginalized community. It is a safety net for them. And it has been also researched to show that how this has kept children in schools. Lastly, we have to reimagine our own families now. There is no doubt that there is dire need for new theories to emerge to understand the evolving social institutions, social, economic, political, and psychological problems of present-day society. It is very important. In the coming years, socialization patterns, human relationship will depend or rather revolve around technology and its influence on our lives. The structural inequities in society will have another dimension, and that of a technological divide. It is an opportunity for us to think out of the box, take challenges, to question the traditional way of doing things. We need to democratize families. It's important. Children's agencies need to be respected, but at the same time, parents have to reschool themselves in parenting skills understand the challenges of the 21st century and how the technology has its influence on all our lives and especially on our children and adolescents. Lastly, our learnings from our experience of working at the grassroots is that there has to be a continuum of care for children, from families to communities and to the school, to protect children from parental and family loss. This needs to be really emphasized. It's not just a family, it's a family, the community, and school. There is a continuum of care, and we need to realize that if we really want children to remain in families and they do not have a parental loss or a family loss. Thank you very much.
Thank you so much, Rita ji. You highlighted very important points that affect the strength of families, from economic distress to violence to various types of social inclusion, and the need to focus on budgeting, women in governance, the schooling system, the inclusion at all levels. Thank you so much. We move on to our second speaker, Ms. Vijay Lakshmi Arora. She is head of programs with Catholic Relief Services, and she has more than 3 decades of experience working in the development sector, and she has a deep passion for children and child protection issues. Over to Vijay.
Thank you, Sangeeta, and thanks, Rita, for the great context setting. I have about 9 points, and I'll be very brief. So I got the brief basically from Lena on what I need to focus on, and essentially, I'm going to share some of the learnings from our, like alternative care intervention that currently CRS is implementing in 2 states in India, one in Odisha, and the other intervention state for us is Tamil Nadu. And, we are actually following 2 different pathways to achieve our results. In the state of Odisha, we are actually focused on working along with the child protection system, and it's really about a system strengthening approach. And in Tamil Nadu, we are working in Kanyakumari district, where there are large number of institutions which are managed by church. And we are working through church partners there, and it's actually engaging with faith leaders to see how we can influence them. And I believe in the Indian context, the church is going to be a very important stakeholder for us to influence, given the large number of childcare institutions they are currently managing in our country context. So in terms of learnings, which I'm hoping would kind of offer food for thought for the Fit for Families, intervention in the second phase. The first learning for us has been that you need to intervene at 3 levels when you're really looking at it from the perspective of, the children, their households, and the communities. And so the 3 levels are actually the level of the self. And when I'm saying level of the self, it's really, the need to kind of bring in that sense of resilience, the hope, the confidence, both amongst children and also their family members. And the child, of course, does not exist in a vacuum. The child is existing in a family context. So there is a need to kind of intervene, at the level of family and the household as a unit. I don't think it's going to work very well, or our interventions are going to be very sustainable if you're just going to engage only with children and not with their families. And having stated this, I think, the families who are at risk, who are going through a crisis, they need an ecosystem which is actually much more supportive. And there has to be an enabling environment or a protective environment or even a safety net, around them for them to be able to cope with their stresses. So that is why I think the interventions need to be designed in such a way that they are engaging at multiple levels, as I mentioned, the level of the self, the households, and the families and the communities. And in the communities, I think we saw an excellent example in the morning's panel, where there were different stakeholders who were brought together. And you can engage with, influential leaders. It could be the SMCs, it is the school, it is the health system, it could be the SHGs, it could be youth clubs. So it's a question of, really identifying who these different stakeholders are and who could actually contribute to, creating this protective environment. And in our own experience of, intervention experience, what we have realized is that stakeholders are willing to offer time voluntarily when they see a purpose for that voluntary work. And they are willing to, offer their leadership. I think we heard this passionate young woman in the morning who said that she really wanted to make a difference, in the lives of women and children in the community. She taught young women to sign their names instead of, doing an angutha chap for their signatures. So our experience also reveals that there are many individuals who are actually willing to come forth to contribute to, creating this protective environment. The other learning that we have had is it's very important that, as you're designing for an intervention, you really think about whether those interventions are going to be sustainable. And, what are some of the scaling pathways or scaling strand if you're really interested in going to scale with your intervention? I think Dr. Modi actually talked about, the need to work on scale. We all realize that it's not going to be enough to just work, in conventional manners and in small areas, but is there a way to kind of, learn from our interventions and work on scale so that the results can be achieved at scale? If you do want to do it, then I think the design stage is the one where you really need to think about both these aspects, whether our interventions are going to be sustainable. And if you are interested in scaling, then, you need to identify those scaling pathways and maybe test them through your, implementation experience to see whether those scaling pathways are going to be relevant for you and they are sustainable as well. And one of the things that I want to point out is, from our experience in Kanyakumari, the districts, there were like really families which were in very, very difficult situation. There is rampant alcoholism in that area, and families have been ripped apart. And strangely, there were a lot of, young people dying in that area for various reasons. So there were a lot of women who were actually single parents. And there were innumerable problems. We were really struggling. Where should we really focus on? The needs are so many, the risks are so many, but our experience taught us that we can't address everything and we don't have to address everything as well. But I think what we really need to do is to give the families and the children the sense of resilience and the hope and the confidence, that they can find, solutions for themselves. And we need to offer them the accompaniment support. That is what we learned. And just to give you an example, during the pandemic, when everything was shut, we were really worried about these families. And we said, okay, why don't we pilot something called a virtual monitoring? So there was a lot of debate about how can you do case management virtually. There is a benefit of doing it in person. But nevertheless, we said, no, let's keep, following up with these families virtually, because this is a very difficult situation for everyone. And actually, just receiving that phone call has helped so many families to actually go through that pandemic situation because they felt that they were not abandoned. And there was a sense of confidence. Yes, I can reach out to this person to, really talk about, okay, this is the problem I'm facing, what is the way in which I can handle it. So having stated this, it's also our experience to recognize that you might want to keep a small pot of money, like a crisis fund, because there were also many instances where families needed immediate financial support. Because there were instances where families didn't have food for even one single time of the day. And these were families in sheer desperation. They had actually even pawned their ration cards with people to get some money because they just didn't have 2 square meals to survive. So what we realized is, while you don't have to provide for everything, like you don't have to provide constantly for food or clothing or everything, you do need to have some kind of an emergency fund, which will kind of help you to support that family in acute crisis, to kind of at least come out of that crisis and stabilize before you can start doing all the other interventions, and slowly build, their confidence and their resilience. And of course, the most important thing is our accompaniment support to them, because you can't just abandon them. You have to accompany them through this journey of, emerging from the crisis to a point where they feel resilient and confident and are able to kind of take actions on their own. So in this context, what worked really well for us was connecting families to different services. So we did map out referral services. We connected them with various service providers, and the families were happy with that. There were families who said that even if you don't provide anything to us, that's fine. But as long as we know whom to reach out to for help, and as long as you are in touch with us, I think that's completely okay. So here you may, at the design stage, you may really want to also think through, depending on the type of organization you are, what is the role that you want to play? Are you going to be the convener? Are you going to be the provider? So you might want to reflect on that as well, depending upon the type of organization you are. And the other point that I really want to talk about is, when we began this piloting this initiative in Odisha, we were trying to work at both ends of the spectrum. We focused on prevention as well. We were working with 3 institutions wherein we decided to kind of, restore some of the children back to their families. But then, while I'm not saying you should not focus on both simultaneously, I think the lesson for us was the need to be prepared when you are trying to, deinstitutionalize a child and restore them back to families. You need to be solidly prepared, because without being prepared, it is going to actually backfire. And you might want to find even other alternative care options, whether they are there in that, in that ecosystem where this restoration is happening. So that was a very big learning for us. And we realized that it's not very simple and straightforward that you just simply say, okay, you have family, so you can go back. No, it doesn't work like that. And from a systems point of view, when we were engaging, there were some of these key learnings. One was, workforce development was a big strategy when we were engaging with child protection system. But what we learned was that our approach to workforce development has to be slightly different. It cannot be just simply doing, training programs or capacity building programs. In fact, what we realized is we need to work at 3 different levels. One is, yes, there are certain elements for which you need to do those formal kind of training or capacity building. But when you're working with the system, you also need to support them in building their institutional capacities. If I am a DCPO and I'm working at a district level, maybe there are certain things where I'm really struggling with. I don't know how to monitor, or I may be struggling with my monitoring system, or there may be other systems where we may want to kind of offer them support. And the third thing, which is I think the most important piece, is the accompaniment, because you need to, whichever stakeholder you're working with, I think you need to be able to help them move from, being the receiver of the knowledge, the skills and the attitudes to, being a stakeholder who can, try and find solutions for their problem. And even as we are working with the child protection system, we felt that this accompaniment support is going to be very important. And so we were we really feel that for us, this 3-fold approach of capacity building is capacity strengthening is what is working really well. And it makes it really sustainable in that sense. And just last 2 points. And as we were working towards, strengthening the child protection system with the purpose of family strengthening, what we felt was that it is not going to be enough for us to be just engaged at the district level, because we started by supporting them, like in doing vulnerability mapping, in coming up with district action plans, and then trying to help them implement the plan, trying to monitor the plans, do referral systems, create a referral network, and so on. But we realized that we need to also work at the village level, at the block level, and the district level. It is not going to fly if you're just going to be focused at the district level. So what are those protection systems or other, structures with whom you can really work on? Like we have the village child protection committees, or now maybe they are operating under a different nomenclature under the Vatsalya scheme. But those are opportunities that we need to kind of leverage. And the related point is, I think there is a great opportunity for us, those who are working in the rural areas, to work with panchayats. Now they have this mandate of, localizing SDGs. And there is a big focus on that. And they are supposed to work towards realizing the SDG goals by leveraging, the provisions meant for panchayats. And one of their role is also to focus on creating a child-friendly, village. And this is part of their mandate. And they are supposed to just not focus only on infrastructures, but also to plan. They have to come up with a like an action plan, development plan process, and they have to focus on these softer elements as well. So those of us who are working, I think, in the villages, in the rural areas, this is a great opportunity for us. And this is something which we are piloting now in 10 districts with the purpose of learning, and we will be very happy to share as we go along. And I think the final point that I really want to talk about is measurements. It's really important that we have clear indicators that we are measuring. We are generating evidence. We are capturing the learning. It is important we do this because we are then able to not only do adaptive programming, in the sense like from that learning, from that results, you might want to tweak your strategies, but also for us to be able to influence other stakeholders. Because when you talk about family strengthening, it looks like one big thing, like it's a very broad term, but how do you define family strengthening? What are you really measuring there? And what will really tell you that a family has become strengthened in a sustainable manner? How do you really break this term into measurable indicators is something which we need to do. And sorry, one final point that I want to share is that as civil society actors who are working on this whole issue of alternative care, I think it's important that we also work or engage with donors, because there is a predominant priority to fund institutions. So how do you influence those donors, from their thinking around supporting the institutions? There are many volunteers, interns who prefer to go to children's home and work, because I'm not saying this is right or wrong, but I'm saying how do you then influence this constituency, especially, when I think the whole discourse currently is towards moving from institutional care to family strengthening and, family-based care options. Thank you so much. Over to you, Samantha.
Thank you, Vijay. You shared two very distinct experiences that you had with Tamil Nadu and with Odisha, working one with the child protection system and the other through faith-based organizations. You've also focused attention on two things that really plague most of development workers, which is sustainability and scale up, something that all of us challenge with. And I think you also raised with some very good points on the type of capacity building that is required, because, we focus so much on capacity building, but where is it going and how is it measurable? So very good points raised there. I'll move on to the next speaker. I'll follow the list as is provided to me rather than the way we are sitting. So I'll move to Nicole. So Nicole has been the founder of Childline India Foundation. And since then, she has also been a co-founder of Leher. And she has considerable experience of child protection, and she writes very avidly on it. So not to embarrass her any further, but over to you, Nicole.
I did not found Childline India Foundation. I was part of their initial team that started. Sorry, it was started by my wife and Jaru. And stalwarts like Rita, who was sitting here next to me, and Sanjay. Childline is a big family. But I was supposed to have a presentation. I don't know if we're using it. Yes. While they set that up, I will just start by saying that I've been asked to talk about, I work with an organization called Leher that focuses a lot on community-led prevention. I've been asked to talk about this piece of work that we have been doing in Madhubani, Bihar, and throw up some of the learnings. So this work actually links to family strengthening because it focuses on that piece of strengthening the ecosystem. Families and children don't exist in isolation. And if we want children to thrive in their families, they have to be supported by an environment that creates space to allow them to thrive, to allow them to move. In our work, we realized that many of the girls in our communities had never been anywhere other than school and to their houses. They weren't even allowed to go out and play. So that is the level at which we need to influence change, not the remarkable superheroes where suddenly it's all rainbows and, you know, like I get very scared of terms like child marriage free, child labor free, but it's, you know, these are things that are very scary because I think somewhere it's about creating a mechanism that can rise to solve these problems, because we all know society is dynamic, communities are dynamic. We are just recovering from a pandemic, which will keep unveiling the impact that it has had on communities and children. We don't even know what that impact is. But the idea is to create a mechanism that can locally come together with the resources that they have. So I think one of the key ideas behind our work is don't put in anything extra. Work with what exists in the community. So I think in our pilot, we were very, very cautious to not even give a cup of tea. You know, because the minute you do that, that whole sustainability question comes up. It's your program and they are beneficiaries, but you're not building partners in change. So oh, lovely. The presentation is up. So this is a very small pilot. It runs in 3 blocks in 36 villages in the district of Madhubani in Bihar. Why did a Delhi-based organization choose to go to Bihar? Because it was one of the most backward districts of the country. And we thought that if we can find some measures and levers of success there, then it will perhaps be easier for us to think about scaling to take it to different other parts of the country. Like I think you heard, I come from this background of emergency response for children, Childline. And I think the more calls that came into Childline, the more we felt problems. If children have to call a helpline, millions of them, hundreds of thousands of them, every day reporting cases, the problem lies somewhere that we are not reaching. And while our country has made great progress in the last 20 years on a response system, we don't have a prevention system in place. And people don't really, knowledge of the protection system exists among us sitting at this table, right? But if you ask a common person in a village or community, क्या आपको 10/8 पता है? आपको CWC पता है? आपको DCPU पता है? सच है कि किसी के पास ये जानकारी नहीं है। और जब तक हम ये जानकारी और ये ताकत उनके अंदर नहीं डाले कि वो खुद चाइल्डलाइन फोन करके केस रिपोर्ट करे, खुद बच्चा को लेके CWC के पास चले जाएं, then we are always going to be this niche of experts who are giving gyan to each other. So the idea was to change that. So we started with 36 villages. We worked through child protection committees, village child protection committees, and children's groups. The work is very focused. It's to build leadership in them, and we sit in the background. So if you go into the field, you will not hear Leher. You will hear, is gaon ka Bal Sanrakshan Samiti, is gaon ka bacche ka group. Idea is to build in them the capacity to be able to fight their battles themselves, to leverage the system themselves, to move forward themselves in making their spaces safe for children. It's been 9 long years. It's a highly participatory project where we really listen and create tools based on what the communities are telling us. The child protection committees work on creating connections to the system, so social protection, and linking cases to the child protection system. They do awareness among their communities. They do what we call Nigrani, which is being watchful and alert to see what is happening to our children. And they keep engaging people, various stakeholder groups, various individuals in conversations about keeping children safe. Over the years, these are small communities, so the numbers are not bombastic. About 2,000 children have been connected to schemes, to social protection, to be able to hold these families together. In our children's groups, where we've engaged more than 800 girls over the last 8 years, there have been no child marriages. When we started, 97% of the villages reported that child marriage was a practice. It was a social practice, and they were very resistant कि अगर हम नहीं कराएंगे अपने बच्चों की शादी, फिर आप कहाँ रहोगे? Right? Now they are willing to make the change. And I think a lot of this is conversations, dialogues. It's not dramatic, it's not remarkable work, but it's really creating that attitude change and supporting it by constantly sensitizing and working with the system at a very micro level. So we start in the village. The village child protection committees start their work in the village. The issues that come from the village drive them into the block and into the district. And I think, as Vijay said, what are the accompaniments to help them stand on their feet? I think a lot of our work has been focused on working with them to build the tools so that they are able to analyze their situation. They are able to identify the issue. So it's not Leher's mandate that they are taking forward, but a mandate that they find practical, sensible to them to take forward in their communities. Just sharing, this has been 9 long years of slow work. So it's not a high flame, but it's a very slow burn work that we have been doing in these communities. Oh, someone has to move it from there. Okay, I'm sorry, but so just sharing that now there is a, how do I say, there is a change in the social fabric. The communities are receptive. So an organization called Praxis that works on participatory research asked us to collaborate with them in Madhubani with the child protection committees to see how we can engage employers on child labor, because they work on responsible business. So very quickly, the committee members did a mapping. They have the tools. They know how to map. They found all the pockets where there is child labor. They found all the industries. Madhubani is a very small district. So वहाँ पे आपको बड़े-बड़े industries नहीं मिलेंगे. You'll get brick kilns, you'll get dhabas, you'll get jeweler shops, you'll get sabzi mandi. There's no like very, very big industry, but there is child labor everywhere. So they mapped it. No mines, no mines. But they mapped, they found out, then they were very scared because वहाँ पे दबंग बहुत है employers. तो कैसे करें? So they were willing to call Childline and report cases, which they did, but they were very scared to negotiate with the employers themselves because they could experience harm. So they only realized that let's engage the labor officers. So they themselves, now they are strong enough. They went to the block, they had meetings in all the 3 blocks with the block labor officers and sought collaboration. In these discussions, the block labor officers, I think they were so motivated by seeing these groups of women so motivated, talking at your and my level. If you go to Madhubani, I promise you, they will sit across and they will have the most logical, confident adult-to-adult conversation on their children with you. Some of them went and started rescuing children. They also gave us information on schemes for migrant workers, construction workers who are going into the cities to work. So we can fast track vulnerable families onto this. Who is doing all of this? It's not Leher or our teams in the field. We exist to support the CPCs. In this conversation, they also told us that they are struggling to implement a really wonderful scheme of the government called DDKY, Deen Dayal Upadhyay Yojana. So the child protection committees went and visited those centers. They found that Madhubani happens to be one of the centers in Bihar where we have in-house residential vocational skill building programs where they are trained on retail with field work, if you please, internship in the local malls, and 100% job placement. The centers were running khali because communities are too scared to send their children. The VCPC members organized a meeting. And mind you, we are not paying a cent, not one naya paisa for any of this. VCPC ने गांव के parents को सब ले गए दिखाने कि आओ देखो हम हैं आपके साथ. 22 girls were admitted into this residential training program. This is a government scheme. Now, in the next year, I think they have to rebid and resubmit the tenders. This is a corporate, it's called Quest. So friends who are working in different states, they work in 8 or 10 states of the country. This is a wonderful thing that we can access. If Quest comes back to Madhubani again, now we found another scheme where all our CPC members, the adult women, can get enrolled for entrepreneurial training. There are 40 courses that they can do residential programs. So slowly, steady, we have had, so this is one example of how when you work in the ground becomes receptive. And then we can push many things through. I want to share another example. How do we institutionalize, right? We are talking about sustainability. How do you make the issue political? So this is not something Leher chased. It was an outcome, which we were quite surprised about. In the Panchayat elections in 2020, this is post-pandemic, because the CPCs played such a strong role in supporting families and community, again, by negotiating with the block, with the district to ensure that facilities and relief was being provided in our communities, they earned themselves a really good reputation. We had 36 members of CPCs stand for Panchayat elections, 28 won. 28 won various posts. Mostly women, some men.
Women are being trained by and monitored by their husbands.
Mukhya Pati, yeah, that's a concept, but it's a start. We all are supported by men, and then we teach men better. You know, so that's it. It starts somewhere. So just sharing. Like this is, now we don't talk about our cases. I don't know if you can see the cases. If you can just scroll forward. This is say 2022. You can see that post-pandemic, we are seeing a big jump in child labor, substance abuse, children out of school. But friends, this is all in a day's work for the child protection committees. I don't think Leher talks about these things anymore. They know this is their thing. They have to do it. They've even spoken at some online international conferences with universities. This is our Maithili speaking group of women. They are fire and dynamite. Why is Leher doing this? Not just to be in Madhubani forever, but to really, what do I say? Create the tools and the means for us to bring prevention at scale into the country's child protection system. And I don't think Leher has ever aimed to do it on its own. So we've developed tools from this field experience. So this is our field where we throw in different things, we make mistakes, we get up and we like lick our wounds and we start all over again. But we've created tools in multiple languages through collaborations with different organizations. I also come from Childline, like I was a Bacha student in Childline 25 years ago. That's okay. It's okay. It doesn't matter. I'll share with you later. But the idea is to create templates to really address the question of scale. So I think we have been working towards being structured enough to prevent chaos and confusion, but flexible enough for it to be adaptable to various different geographic, social contexts. And we've been fortunate. It took us many, many years, much longer than we thought, because we thought we were so great because we were part of creating Childline that Leher also would be like magic. No. It took 10 long years, but today, through different collaborations with larger organizations like Miracle, like UNICEF, like Childline India Foundation and its partners. We're now testing this for scale. So we've got 5 states, about 100 districts going, about 450 villages, child protection committees coming up, leveraging the strengths and the experience and the knowledge of other much larger organizations. I think this is a piece that we're hoping will find a space within the family strengthening discourse, because when we want children to go back to their families and communities, there has to be something that helps hold that whole family structure together. It has to be sustainable. It can be sustainable when it's owned by the common person. So we don't want the child protection committees to be just another Sarkari committee that exists on a file on paper, but it's got to be a dynamic group that everybody in the community, the most marginalized person knows about and is able to reach out to. So that's a sharing. I think it sort of unpacks a lot of the framework that Viji placed. There's one thing that we do. Do I have a minute? I'm done. No? So some challenges. It's not been easy. We've done this without an institutional funder because we did not want to be trapped by log frames and deliverables and 3 years may dikhao impact. At the same time, measures and impact are really important. And I think looking at who are the castes who are active in our CPCs, how are we reaching the most marginalized? How are the conversations changing? These are some of the indicators that we have been able to measure over the 9 years of work in the community. And like Viji said, now it's about convincing the funders. Because when children stop working, then how do you show so many rescues? When children are not getting married, what are those indicators of change? So that has been a challenge, but we've been able to generate some impact data, and we're trying to get an academic institute to work on these indicators with us. Working with boys has been a huge challenge. We have failed, I will say this outright, in Madhubani, because I think by the time boys are 8, 9, 10, their lives are already set for them. Yes, so they know they are going to work. They know that 3 months they'll be in school and 3 months they'll go somewhere at work. So, and I think the big mistake we did was talking to boys about girls' problems. So talking to boys about child marriage, right? These are things that they don't resonate with them when boys have their own issues. We did not have the money, like there's popular belief that unless you play games, you can't get boys to sit in and have conversations. But that is something we just failed. We've not been able to do. Okay, 1 minute. Yeah, so really these were the 2 big challenges. And also the fact that as state governments notify child protection committees, they're more and more making them very heavy on the government representatives. And many organizations, including NGOs, are all too excited to go and notify according to what the government's saying, instead of fighting that a little bit and saying we need the common person's participation. We don't need another Sarkari committee, right? So the minute it becomes a power holder, then we're unable to build on that spirit of volunteerism which will address our sustainability issue. We think that if we institutionalize, everybody is patting their backs that CPCs and in the new form, Women and Child Development and Protection Committee will now be entitled to 5% of the panchayat funds. And we think, oh, wow, we've institutionalized it. But how hard is it to get even 1% of that 5% into a meaningful program for children? That will only happen when the common person demands it. And if we make the committee only Anganwadi worker, only teacher, only mukhya, only stakeholder, who is a power holder in the village, then that's not going to happen. So these are some of the challenges. And let's hope we journey together. and like collaborate stronger and better, because we are a very large country. 450 villages is like nothing. We've really got to reach every village and every urban under-resourced community in the country. Thank you.
Sir, we'll have a question answer session at the end. So
Dr. Rajesh,
absolutely, we promise. Thank you, Nicole. Thank you for sharing Leah's experiences of community-led prevention in Madhubani, Bihar. We move on to the next speaker, Mr. Sanjay Gupta, who is the co-founding funder of Chetna. I'm not getting it wrong now. But today he's wearing a different hat here. He is the chairperson also of the National Action and Coordination Group, part of SIVAC. And it is in wearing this hat that we would like him to speak about the coordination group and how he sees alternative care as part of that.
Thank you. थैंक यू आप सभी को बहुत धन्यवाद, बहुत पेशेंस से आप लोग सुन रहे हैं. और आई थिंक द टॉपिक इज बेसिकली अबाउट डिबेट अबाउट विच इज द सेफ प्लेस. दोनों घर हैं, एक घर अपना और एक घर सरकार का या संस्था का, तो इस पे बहस चल रही है. तो यू नो आई विल पुट माय पर्सपेक्टिव एज द चेयर ऑफ NACG, बट बिकॉज आई हैड वर्कड सो मच ऑन दिस इशू सिंस I had started working in 1992. So you cannot just run away कि ये बात हम नहीं बोल सकते हैं. I think मुझे ऐसा जब से मैं ये सुन रहा हूँ, I don't think this is a new issue. We were talking it about since inception. This is almost 30 years. Rita Panikkar ji is sitting here, and when Chetna was founded, I got inspiration for butterflies, and we always talk about non-institutional approach. So then, you know, but the issue is that because the country is so wide and so much rich of experiences, good or bad, that there was a demand, there was a need that we should also have a home, which are done by the NGOs or by the government, because there were issues and there still are issues. तो मुझे लगता है ये एक अनुभव चक्र है जिसको हम पूरा करते हैं. पहले ऐसे करते हैं, फिर थोड़ा सीखते हैं, फिर लगता है नहीं यार होम अच्छा है. आज जब हम 30 साल आगे आ गए, अब हमें लगता है नहीं फिर से वापस घर अच्छा है. So I think this is an experience cycle, which is very well, appreciated in the development sector. Until unless we are able to work upon the, whatever has been mistaken, अगर कुछ ठीक से नहीं हुआ, अगर उसको हम correct करते हैं, तो मुझे नहीं लगता कोई इसमें दिक्कत है. जितने भी विषय, जैसे अगर I am not sure if you are aware about the NACG. NACG is National Action Coordination Group, which is a part of a SAARC treaty, which is called South Asia Initiative to End Violence Against Children. And for that, every country, the SAARC country, has to have a NACG in their country. So similarly, NACG India, NACG Pakistan, NACG Bangladesh, like that. This is a civil society forum which has endorsement from the MWCD. I have recently met almost 3 times now the new GS, Madam Indra Mallo, and we are taking it forward. So the thing is that because the NACG has mandate to work upon child labor, child trafficking, child sexual abuse, corporal punishment. So what are these issues? These are the issues which are existing from many, many years. This is not new. Why a child is forced to leave his or her home? Maybe because of one of the issues which are not able to hold him or her at the home. It may be bad parenting, it may be city attraction, it may be the child is not able to go to school and he or she is now moving on streets and doing some work. Traffic, is victim of any one of the abuse by the parents or by some relative. So once that happens, then automatically now, because the system is very strong, we have a very prominent, I would say, systems. Juvenile Justice Care and Protection Act and the POCSO and all this are with us. So the only alternative is when you find such child in difficulty, there is a system which produces child to the home. When comes to home, then child stays. If the situation at the homes are conducive, can be sent back. If not conducive, it is the CWC prerogative or whatever observation report from SBR or something. They can say, okay, please continue in the home. तो मेरा पक्ष ये है, थोड़ा सा इसमें डिफरेंस ये है कि मैं एकदम से स्ट्रॉन्ग वकालत ये नहीं करना चाहता कि बस होम में ही भेज दो, मतलब वापस भेज दो टाइप से. मुझे लगता है कि जब तक वो कंडीशंस या वो सिचुएशन फॉर विच द चाइल्ड हैज लेफ्ट होम फॉर व्हाटएवर रीजन, अगर वो एड्रेस ठीक से नहीं हो तो इट कैन ऑल्सो बी ए रिस्की प्रपोजल. So you have to be very careful when we are, saying it passionately that this is happened. मुझे याद है किरण जी, एक दिन आपने ना, बहुत पुरानी बात है, आपको याद दिलाता हूँ, तो आपने मुझसे कहा था, यार संजय तुम कैसे कर लेते हो, है ना, ये रेलवे स्टेशन पे आपने पूरी टीम बिठा रखी है, बच्चे हो, हम लोग तो होम्स करते हैं. तो मैंने उल्टा आपसे कहा, किरण जी आप होम्स कैसे चला लेती हो, ये मैं नहीं समझ पाता हूँ. कितना मुश्किल काम है एक होम चलाना, एक बच्चे को रखना, एंड यू हैव टू बी वेरी वेरी केयरफुल. द लॉज आर वेरी स्ट्रिक्ट. You have to abide by everything. If something goes wrong and you are in a bad name as an organization, उतने मुश्किल के साथ भी अगर होम चल रहे हैं और होम चलाए जा रहे हैं सरकार के द्वारा, एनजीओ के द्वारा, तो आई डोंट थिंक इट इज अ बैड प्रोपोर्शन. अगर नहीं होगा तो फिर पता नहीं क्या होगा. बट कॉन्ट्रेरी जो मुझे लगता है जो बहस चल रही थी वो ये है कि यस, इसमें कोई बात ही नहीं है कि द फैमिली इज द बेस्ट प्लेस टू बी यूनाइटेड. जो आपने अभी टाइटल दिया है फैमिली का, वो बहुत अच्छा है, होना ही चाहिए. अभी आज सुबह बच्चों ने एक बहुत अच्छा स्केट दिखाया, तो मेरे दिमाग में ये बात घूम रही थी. सो वी वर स्ट्रगलिंग इन द वेस्ट दिल्ली टू गेट चिल्ड्रन एडमिटेड टू स्कूल. हमने बहुत उत्साह में आके CWC में पेश कर दिया अपना केस. 22 बच्चों का केस था. 40 से ज्यादा ऑर्डर चेतना के खिलाफ हो चुके, मतलब चेतना के लिए हो चुके हैं, खिलाफ नहीं हुआ. आई एम सॉरी, आई टेक माई वर्ड बैक. खिलाफ नहीं, सिस्टम में है, क्योंकि हम पिलर टू पोस्ट घूम रहे हैं, एडमिशन करा दो, एडमिशन करा दो, एडमिशन करा दो. भाई कौन करा दो? बच्चा तो ही इज नॉट फ्रॉम दिल्ली, कोई बात नहीं, आधार कार्ड बना दो. आधार कार्ड बिहार का है. स्कीम्स दिल्ली गवर्नमेंट वेरी स्पेसिफिकली, वो कुंडली चलेगा नहीं तो मैं उनसे पूछता, वेरी स्पेसिफिकली दे सेड नो, दी स्कीम्स व्हिच आर मेंट इन दिल्ली आर मेनली फॉर चिल्ड्रन हु आर डोमिसाइल ऑफ दिल्ली or staying in Delhi for long, or have some kind of proof that yes they are resident of Delhi. So the schemes, getting schemes, fetching schemes for the family is a still nightmare, I would say. वैसे मैम बैठी हैं, मुझे नहीं पता आपने कितने ऐसे केसेस में बच्चों को स्पॉन्सरशिप दिला पाए फाइनली, या दिलाते होंगे मैम, मतलब मैं चैलेंज नहीं कर रहा हूँ, बट इतना आसान नहीं है. So on the one hand, when we say that yes, homes are the safest place, we need to actually help out the system with the collaborative effort, whatever, that the schemes which are meant for children and families are able to received by those families. सुनने में बहुत अच्छा लगा, आज बच्चों ने भी बहुत सारी स्कीम्स बोली, तो मैं ठीक है, बहुत अच्छा लग रहा है सुनने में. बट वो स्कीम्स को कैसे लाएंगे? चारू मक्कर जी हमारे साथ बैठी हैं, करुणा जी हमारे साथ बैठी हैं, हमारे साथ अभिजीत भाई बैठे हैं, सब एक से वेटरन हैं, सबने बहुत अच्छा काम किया होगा फील्ड में. हम लोग खुद वी कैन फील दैट व्हेन इट कम्स टू एक्चुअली गेट द राइट ऑफ द फैमिली एंड हेंस thereby ensuring the right of the child is very difficult to get system in the place. So what is the proposal? So really admire आपने आज ये मीटिंग बिठाई, सारे लोग आ गए. मेरे दिमाग में तो एक शेर भी आ रहा था, तो कह दे पढ़ दूं मैं, थोड़ा सा माहौल थोड़ा बदल जाएगा. रंग बरसेगा नूर बरसेगा, रंग बरसेगा नूर बरसेगा, लम्हा लम्हा सुरूर बरसेगा. आज किरण जी ने बैठक बुलाई है सिविल सोसाइटी की, तो शाम तक ये बादल जरूर बरसेगा. तो एफर्ट्स आर मेन, मतलब अगर आप एफर्ट नहीं करेंगे तो कैसे होगा? तो एफर्ट तो होने चाहिए, बट जो करेक्टिव मेजर है मेरे ख्याल में, एक तो I would strongly believe we have recently started an experiment in West Delhi in the able leadership of Mr. Prince. He is the DM. Now he's calling every month meeting of all the stakeholders. He has formed a WhatsApp group. Why these children are on the streets? Why homes are not taking them? Why the SIR are not made? Why? And the people are, very scared. Every day, in the process, I came to know that there is a lead bank manager, concept of a lead bank manager. Why we are struggling? There is a lead bank manager who can help you at the district to open bank account in any of the bank. So there is a system, but people are not practicing it. And hence, and because of awareness, lack of awareness, sometimes we tried our level best to, to let the child and the family get the system in place. Sometimes it is seems difficult. So my suggestion would be to the panel that I think again I would say yes, non-institutional approach is the best approach, but to ensure that we need to also have the protected family system. If the families are protected, if there are no reason for children to leave home, if there is no sexual abuse among these families, if there is no trafficking cases, if we keep minimizing that, so this is not a ये रात में तो हो नहीं जाएगा, मतलब समय तो लगेगा, but at least we can practice that. We can create some models, like if something is happening in West Delhi, something in South Delhi, so we can, if we keep sharing the learning, what is working, what is not working, and engaging with the DCPCR or the system, I think this problem of creating a caring family system first, and then we can start shifting. एक चीज मैं और कहना चाहूंगा कि बीच में एक बात बहुत आई थी, जब ये देखा गया कि भाई होम्स में बच्चे बैठे हुए हैं, और अनफॉर्चुनेटली हम सबके ऊपर ये एक एनजीओ सेक्टर में भी एक एलिगेशन लगा कि शायद हम चाहते हैं कि वो होम में रहें क्योंकि इससे हमारा होम चलता है, और इस तरह के एलिगेशंस आए बीच में। फिर बाद में जब उन पर देखा गया तो कुछ हुआ कि भाई बच्चे को ट्रैक करके वापस फैमिली में भेजा गया। वो एक्सपीरियंसेस मेरे पास नहीं है कहने के लिए, बट कहीं ना कहीं हमें एक सिस्टम में ये रिफाइनमेंट भी नीड टू हैव दैट द चिल्ड्रन हु आर लिविंग इन होम शुड गो थ्रू अ एनुअल काइंड ऑफ अ प्रोसेस वेयर we have to take this note whether the child is really ready to go back to home. If they are really ready to go back to home, they should be placed back to the home, but by ensuring that the family, the reason for which the child has left is now settled, family is settled, there is no such issue, and then we are happy to talk about home integration. Thank you so much.
Thank you, संजय जी। आपने बहुत सारे मेरे ख्याल से कुछ पेचीदा सवाल रखे हैं सारे पैनल के सामने और सबके सामने कि किस कॉन्टेक्स्ट में डी इंस्टीट्यूशनलाइजेशन होनी चाहिए, क्या फैमिली के हालात हैं, और इतना ब्लैक एंड वाइट तरीके से नहीं देखा जा सकता है इंस्टीट्यूशनल केयर वर्सेस नॉन इंस्टीट्यूशनल केयर। Thank you. We'll move on to our next speaker, Sandhya Mishra. She is the program director with Miracle Foundation and works on family strengthening and family-based alternative care across the country. Today, she is here representing India Alternative Care Network. She is a core committee member, and she's going to speak wearing that hat. Yes. Thank you, Sandhya. I need help from the presentation.
Okay, so thank you so very much. By the time team is settling up with the presentation, yeah. I'm so glad that today in this discussion, this consultation, this particular topic has been chosen, especially the role of collective and networks in strengthening family, promoting family strengthening. And I'm so blessed that I'm representing a network today. So the point which I wanted to share, recently I was part of one of the consultation, and there I've heard that sometimes nothing happens in a decade, and sometimes a year happened, a decade happened in a year. So, and which is, I think I would like to mention about, especially the network and collectives, and especially because of several government guidelines, and people are very open to share their best practices with each other. आजकल मुझे ये भी लगता है कि बहुत अच्छा लगता है कि जैसे अभी निकोल ने कहा कि बच्चों के साथ, लड़कों के साथ काम करना was not very successful, it was actually failure. तो ये बहुत खुशी होती है that people actually now organization, they share their failure, they share their best practices also, but the failure also. Okay, so go through the presentation. I'm one of the core committee steering group member of India Alternative Care Network, and also I'm working with Miracle Foundation India as program person and government partnership person. Okay, next slide, please. So this actually during Viji's discussion, and somewhere Nicole also has touched upon about this family strengthening model. This is not something new model. So this is something which I have taken from changing the way we care. So you can see this particular model where we talk about the primary or universal level, where we connect with the family and the community at larger issue. It's like a societal issue which we discuss and we address. Maybe some related to policy, children with disability, how to work with the mindset, child protection committees, which is not something very, very fixed agenda. We work with the larger issue. At the same time, when we go to the next level, we see the secondary level where we have families. I mean, organically, it happens that when we work at that level, we actually come across with the families, those who are at risk. ऐसे परिवार, ऐसे बच्चे जहाँ जिनको की कुछ खास सपोर्ट की जरूरत होती है, चाहे तो वो सेपरेट हो सकते हैं या फिर उनको डर है, उनको कोई खतरा है. ये हो सकता है कि because you need the services they need is individualized counseling, maybe they need in terms of parenting education, parenting skills, social linkages with the social protection schemes. So then we have these particular secondary, and the third level we call it tertiary level, where either children already the gatekeepers here in India we say child welfare committees. So the child welfare committees, they already have identified that these group of children actually, they hit the system and they need to be, separated from their families, or the children are reintegrated back to their families. What we discuss, we are hearing since morning. Restoration हुआ है, या तो बच्चे family में गए हैं या बच्चे जो हैं वो गेट CWC के लेवल पे हैं. और इसमें बच्चा जो है वो एक सेंटर में है, आप उसको हम बच्चे को सेंटर में रख रहे हैं. नेक्स्ट स्लाइड में अगर हम जाते हैं, मैं बहुत डिटेल में नेक्स्ट स्लाइड के बारे में बात नहीं करूंगी. नेक्स्ट स्लाइड आप प्लीज. ओके, तो इसमें एक बहुत इंपॉर्टेंट एरिया है जो कि हमें जानने की जरूरत है. मैं क्यों यहाँ पर कलेक्टिव एंड नेटवर्क की इंपॉर्टेंस की बात कर रही हूँ? बिकॉज इफ द फैमिलीज आर एट रिस्क दिस लेवल, वेयर यू हैव irregular income, you have a civic amenities issue, where health issue, etc. And if you are not showing any action, there is an inaction. So obviously family will be in crisis. A crisis could be a addiction, poverty, poor health condition. And then again, you are showing inaction. I mean, when we say you means like we as a society showing inaction, then it is resulting to children being separated from their families in the street. Then you suddenly realize, no, we have to do something for these children and family. So then again, we take action. And that is a reintegration part. So when we do reintegration part, of course, this needs lot because damage is already done. And then we start working on, all these, different services. And then, of course, working with children, domains like what we, this morning we discussed about 10 well-being domains and different kind of services for children. But if you see that when you identify children, family at this level, and you show action there only. So this is something, the child need not to go to the entire circle. This is a one area of the prevention where we are working with the entire family, children, the group, wherever the family is at risk, and we are taking care of that. This particular thing is not possible only by one organization. We can't work in silos. And it is humanly not possible to work in all these areas, even if in one community. Since morning, we have heard about it. And see, family strengthening is not something just happened 3 years back. And family strengthening is only the organization like all of us sitting here is doing. Family strengthening has been happening since ages in India. And different organizations are doing. बहुत सारी organization. मेरी पहली organization जहाँ मैंने काम किया था, जब मैंने MSW करके आई थी, तो दिल्ली में ही अलकनंदा कम्युनिटी में मैं काम करती थी. और वहां पर मुझे जो काम मिला था वो मिला था स्पॉन्सरशिप था. बच्चे जो हैं उनको पढ़ाई में रहे, वो पढ़ाई से अलग ना हो. तो मैं लड़कियों के साथ, बच्चों के साथ काम करती थी वहां पर. ज्यादा गर्ल्स की थी ग्रुप में. तो वहां भी मैं अभी सोचती हूँ, हाँ मैं भी तो वही कर रही थी ना. तो पॉइंट अब ये है कि कैसे ये सारी ऑर्गेनाइजेशन एक अम्ब्रेला में आए, so that there's no only one particular organization working for they're responsible for family-based alternative care or family strengthening. So the next slide I would go for, that is why the need for this kind of network was felt, India Alternative Care Network, which is a collective that brings together diverse array of experts, practitioner, policy advocates, who are working for well-being and protection of children. So we have Vijay, we have Rita ji, Sangeeta, Kiran ji. We are part of this, steering group member. So this is something which, the India Alternative Care Network was established so that all these good practices, best practices, resources, information, everything to be put, at one place, and then, people and the organization, those who are working in this area और सोच रहे हैं कि हमें इस area में काम करना है, तो हमें कुछ direction मिले. Next slide. Strategy जो है वो clear है कि हम कैसे invite करें, engage करें, empower करें. ये 3 important area है जिसके साथ हम काम करते हैं. Capacity building, कैसे हम knowledge build करें, knowledge and share करें. Then capacity building of stakeholders, and important part is policy and action. That is something which at India Alternative Care Network we do. Next slide. This is a very small this thing. So this is a steering group member. The list needs to be updated, but you can see the list here. This all people like part of this network is like coming with the diverse experience, expert in their field. And the idea is a voluntary, so that everyone is coming with their piece of knowledge, experiences, failure, learning, and just share, so that the people, those who want to work in this area, the organization, those who want to work in this area, or other organization can be benefited, and especially how the social workforce and any organization and children can be, ultimately the children should be benefited. Okay, some initiative I would want to share, that what India Alternative Care has done in promoting family strengthening. One such we did discourse in, there are several learning events we do, webinar, seminar. This is what about the Mission Vatsalya, where critically we examine Mission Vatsalya. Next slide. Then these 2 pearls India Alternative Care has contributed in the sphere of alternative care and family strengthening. And I must, strongly, highly recommend you that go to the website of IACN and you see these resources there. So we have a compendium on family strengthening, and we have FAQ on, like all frequently asked question and all topics and concept related to family strengthening and family-based alternative care. So what we have learned, next slide, in these resources, what you will find the concept. The moment we started talking about family strengthening and family-based alternative care in last maybe rigorously, I would say, maybe 5-6 years back in India, हमें एक चीज की बहुत ज्यादा जरूरत लगी कि कॉमन नैरेटिव नहीं है. मैं फैमिली बेस्ड केयर मैं कुछ और बोलती हूँ, कोई और ऑर्गेनाइजेशन कुछ और बोलते हैं. मैं फैमिली स्ट्रेंथनिंग कुछ और समझती हूँ, कुछ दूसरे लोग कुछ और समझते हैं. तो हमने इसको कॉन्सेप्चुलाइज करने की कोशिश की ताकि एक लैंग्वेज हो. हम यहाँ पर हमने इसमें ये भी बताया कि क्या क्या कॉम्पोनेंट्स हैं फैमिली स्ट्रेंथनिंग के, वो हमने इसमें इंक्लूड किया है. इसमें गेट कीपिंग को बहुत अच्छे से डिफाइन किया गया है. एंड सबसे अच्छी चीज आपको मिलेगी कि इसमें हमने 8 जो बेस्ट प्रैक्टिसेस हैं जो ऑर्गेनाइजेशन फैमिली स्ट्रेंथनिंग पे काम कर रहे हैं, कीपिंग दिस फोकस इन माइंड दैट चिल्ड्रन आर प्रिवेंटेड एंड व्हेन द चिल्ड्रन आर रिस्टोर्ड बैक, हाउ टू सपोर्ट इट. सो दिस इज विल बी हाईलाइटेड, एंड ऑल्सो सेवरल वंडरफुल पावरफुल केस स्टडीज स्पेशली फ्रॉम इंडिया, क्योंकि हमें सबसे ज्यादा जरूरत यही होती है कि हम काम तो बहुत कर रहे हैं इंडिया में, वो डॉक्यूमेंट कहीं नहीं हो रहा है. हम फॉरेन कंट्रीज के एंड ग्लोबल ज्यादा स्टोरीज देखते हैं. आपको वो चीज यहाँ पे मिलेगी FAQ में एंड कंपेंडियम में. नेक्स्ट स्लाइड. ये न्यूज़लेटर्स हैं, जो क्वार्टरली न्यूज़लेटर्स होते हैं. आप अगर कोई भी साइट पे जाएंगे, you will find, I think now we have 9 issues. We have our secretariat person here. Where is she? Maninder? Oh, okay. Okay. 11th is coming soon. So she's our secretariat coordinator, national coordinator, Maninder. तो हमारे न्यूज़लेटर में क्वार्टरली न्यूज़लेटर में आप अगर हमें टाइम नहीं मिलता है पढ़ने का एक्चुअली, लेकिन अगर आप उसको पढ़ेंगे तो आपको लगेगा कि कितना काम हो रहा है इंडिया में, ना बढ़िया काम हो रहा है. छोटी छोटी ऑर्गेनाइजेशंस भी कर रही हैं, and they are now reporting all the best practices. There is a column for youth. We interview them. They talk about their initiatives. So this, you will see, everything is on the website. And then there is a special section for family strengthening and family care. The point which, yeah, next slide. Yeah, 1 minute. Okay. This is something now, the contribution towards family strengthening. We have three working under India Alternative Care Network. We have 3 working groups. The third working group is about family strengthening, where we are now planning to have a research, primary research on family strengthening to, demystifying family strengthening, and also open our session. IACN website, we want to be more resourceful, and cross-cutting theme of psychosocial support and disability. We want to be, like part inclusive of all this discussion. And ultimately, we want to reach out to the, government policymakers, so that the idea is for all these things that everyone should be supported. So if I want to start a program, or if I want to think about, okay, I need to conceptualize something in my area, I need not to reinvent the wheel. I have everything there. I can go, you will find tools, you will find resources, you will find all kind of, the supporting this thing. Or if you don't have, call the network and you will be supported. So few, I think, way forward action point. Can we go to the next slide? So again, I mean, we have other network, Better Care Network also is a global network, which actually contributed a lot in forming IACN. It's a one-stop information, fantastic network. Next slide, please. This is a new collective, which is started last year only. It's a NEEV collective. It's a group of organization. Leher is part of that collective, which actually working for family strengthening. All the experts like M&E expert, research expert, family strengthening, child protection, सभी लोग एक साथ आकर के काम कर रहे हैं, और बहुत अच्छा इनिशिएटिव है ये. कुछ वे फॉरवर्ड में बताना चाह रही हूँ आप लोगों को, जो आपका की टेक अवे हो सकता है. लास्ट स्लाइड. हम ये चाह रहे हैं कि आप और ज्यादा जो ये काम यहाँ पर हो रहा है, और दूसरे और भी ऑर्गेनाइजेशन जो काम कर रहे हैं, वो प्लीज आप शेयर करें IACN से, इंडिया ऑल्टरनेटिव केयर नेटवर्क से. हम और ज्यादा पॉलिसी को, गवर्नमेंट को इन्वॉल्व करना चाहते हैं इस डिस्कोर्स में, कनेक्शन में. यहाँ पर वैदेही मैडम हैं, वरुण यादव जी हैं, तो और इसको किस तरह से विजिबिलिटी मिले, क्योंकि सभी को सपोर्ट की जरूरत होती है, और हमें उनसे गाइडेंस की जरूरत होती है. IACN में एक एक्सचेंज, IACN एक्सचेंज करके है, जहां पे यू कैन स्टार्ट द डायलॉग and share more and more case stories, which we can, include in the newsletter, and also enhance participation of youth and children through this kind of network, so that they can find their meaningful participation for this. So thank you so very much. Yeah. Thank you.
Thank you, Sandhya. Thank you so much for talking about IACN and the need for collective action. We'll move on to the last speaker of the day, last but definitely not the least, not of the day, of today's panel, Preeti Patkar. She is a co-founder and executive secretary of Prerna, an organization which has been working for several decades on combating trafficking in India. And we'll ask her specifically to talk about community-based gatekeeping.
Thanks, Sangeeta. Thanks, Leena and Kiran, for inviting me. I was so worried Leena पीछे से बोलेगी last 2 minutes. So मैंने संध्या को बताया था माइक मेरे पास आने तक 2 मिनट ही मुझे मिलने वाले हैं. तो नहीं नहीं, मैं कभी नहीं छोड़ती हूँ माइक। सबको अगर 15 मिनट
मेरे सामने बैठे हुए हैं, बोलेंगे हम नहीं छोड़ेंगे।
हाँ, अगर सबको 15 मिनट मिले तो मुझे भी मिलने चाहिए। सो मैं फेंस के उस तरफ हूँ, ओके, जहां पे मैंने गए 30 साल जो बच्चों के आवाज सुने हैं, वो ये है कि हमें चाइल्ड केयर इंस्टीट्यूशन में नहीं रहना है, हमको फैमिली में रहना है। हमारी फैमिली में प्रॉब्लम्स है, मगर फिर भी मुझे फैमिली में रहना है। और हमने ये भी देखा है कि जब हम बच्चों को जबरदस्ती से फैमिली में रखते हैं उनके इच्छा के विरुद्ध, तो वहां पे ट्रॉमा और सेल्फ हार्म काफी दिखाई देता है। और हम एज इट इज देखते हैं कि बच्चे जब चाइल्ड केयर इंस्टीट्यूशन में आते हैं एक सेट ऑफ ट्रॉमा के वजह से या उस जर्नी में ट्रॉमा लेकर ही आते हैं, फिर चाइल्ड केयर इंस्टीट्यूशन वो ट्रॉमा और बढ़ाता है। और इसीलिए मुझे लगता है ये गेट कीपिंग बहुत अहम है। मुझे जो ब्रीफ दिया गया था, लीना कहाँ है तू, मुझे बताया गया था कि आपके ऑर्गेनाइजेशन के बारे में कुछ मत बोलो, ओके? तो मैं नहीं बोलने वाली हूँ मेरे ऑर्गेनाइजेशन, मुझे वो ब्रीफ दिया गया था। चलेगा लीना, दैट्स ओके, दैट्स ओके। तो हम जब गेट कीपिंग के बारे में बात करते तो एक बहुत इंटरेस्टिंग ये डेफिनेशन है जो हमें काफी एक मार्ग बताता है। आई एम जस्ट गोइंग टू रीड आउट दैट गेट कीपिंग definition. Gatekeeping is a recognized and systematic procedure which ensures children and families are referred to the most appropriate service. I love this word, appropriate service or care arrangements with the aim of limiting the number of inappropriate placements. So it talks about placements and not about institutions. Okay, यहाँ पे मैं क्यों ये emphasize कर रही हूँ inappropriate placement? One, because of what Vijay said, very important, we need to reimagine families. फैमिलीज जैसे पहले थे अब नहीं है, बहुत बदल गया है फैमिलीज में, उनका इकोसिस्टम बदल गया है। उसी के साथ when we talk of alternative care and gatekeeping also, alternative care में एक भाग है, gatekeeping का एक भाग है alternative care. When we talk about fit person, foster care, kinship care, we need to reimagine all these as well, because kinship care, extended family care जो पहले हुआ करता था, the Hindi movie type, it's not like that today. Families, extended families are reluctant, and let's accept it. Let's not force these things just because theoretically at some stage we heard it. Okay, so let's reimagine all these also and also take baby steps. I'm so scared of foster care because I feel 10 years down the line, today we are talking about how harmful childcare institutions are and how unsafe some of them are. We're going to meet, and let's not meet 10 years from now. Let's start talking about, do we have the bandwidth to have this foster care system? I know adoption is not part of alternative care, and I know today that's not, it's a permanency care. I understand that, but I think even adoption is one area we really need to talk about while we are talking about care for children. I think gatekeeping, when we talk of gatekeeping, we should always remember that it is preventing unnecessary child and family separation. गेटकीपिंग में और एक भाग जो हम कभी नहीं बात करते हैं, वी टॉक अबाउट कम्युनिटी गेटकीपिंग, मगर उसी कम्युनिटी में बहुत सारे बच्चे डी इंस्टीट्यूशनल और या फिर रेस्टोरेशन. सो लेट्स नॉट जस्ट टॉक अबाउट डी इंस्टीट्यूशनलाइजेशन, वी फॉरगेट रेस्टोरेशन, because post restoration also children and families and communities need support. So the other part of gatekeeping is how do we prevent re-institutionalization of children. Okay, यहाँ पे और एक gatekeeping क्यों अहम है, वो इस वजह से, because every time we remove a child, even for foster care, today we are removing a child from his natural birth community to a different family which is not physically in that community. Similarly, institutional care does that. Similarly, fit person does that. The minute you remove a child from his immediate birth, his immediate natural community, you're making that child invisible for everybody. And this is one aspect I think we should all remember when we are talking about child protection and child care. Moving to gatekeeping mechanisms, I love this African phrase which says, it takes a village to raise a child. I would say it takes a village to raise, protect everything, a child and a family. And very classically in gatekeeping, what we've done is we've looked at the typical child protection systems within a community. तो एक CPC देखेंगे, बच्चों को देखेंगे, बच्चों का collective को देखेंगे. There I feel we should socialize child protection and child care. Don't leave it in the hands of a few. Let's socialize it completely. How often have we gone to a political party? I'm not talking about a politician alone. A political party and gone and told him कि भाई ये बच्चा is not safe in his family. It's your mandate because his family is electing you or is likely to elect you. तो ऐसे जो mechanisms है, जो stakeholders है, जिनको हमने कभी भी छुआ नहीं है, जिनके पास हम कभी ये mandate लेकर नहीं गए, I think it's time we start looking at those systems, those stakeholders in the community. It's already been listed out by all. Magar just to add a few, I loved somebody who said they involve faith leaders. हम नहीं जाते उनके पास. We don't go. इतने places of worship रहते हैं. They are such influencers in the community. We are not tapping their doors and saying child protection and child care should be your mandate. Similarly, we have child welfare police officers. No, we think they only do policing work. Why is it that we are not tapping them, putting it on their mandate and saying gatekeeping is also your mandate? Similarly, Mahila Mandal, self-help groups, very well set, schools, and child welfare committees, they are the strongest. They feel, they have still not identified themselves as being part of communities. They're just sitting in their offices and they feel that is their mandate, or sitting in childcare institution and they feel that is their space. I feel their space is beyond that. I know prevention is not their mandate, but gatekeeping definitely is their mandate. And why not stay in touch with the community while you're doing the gatekeeping mandate? यहाँ पे और एक चीज जो मैं कहना चाहती हूँ, जो ऑलरेडी कहा है, it's so important we engage the community and mobilize community. हम नहीं engage करते हैं community, बहुत करते हैं. Of course we engage communities, but it is very tokenistic or decorative. When will we have this absolutely meaningful engagement and mobilization of the community, which is again extremely key to gatekeeping? The other part that, my next point is when we talk of alternatives. So now I'm going to speak a little bit about Prerna, okay? The Prerna model of having the night care center for children born in the red light area. With evidence, it's proved that when you have these kind of community-based centers for children, you prevent a lot of harm. You not only give them that, alternative care and alternative shelter to children in need, but you also prevent a lot of harm. So why aren't we looking at these? We are so stuck with alternative care services, which is defined in the Juvenile Justice Act. We feel it ends there. I think we need to also reimagine that. Probably just reimagine nahi kiya ab tak. For example, creches. No, we don't talk about creches. We are talking about now this women and child protection committees. We don't see how creches help children, but it also helps the mother. And it strengthens the mother's capacity to care and protect her child. It helps her negotiate better over the care and protection of her child, because when there are no creches and when the child is also experiencing and the mother is experiencing domestic violence, she continues to experience that. Have childcare facilities and see how a negotiation capacity over domestic violence. So we also need to have in gatekeeping child protection and domestic violence intersecting, the discussion around both this need to intersect. So I feel that is also part of gatekeeping. Gatekeeping mein another thing that we need to now start talking about reimagining is the childcare institution space. How can we use your space better for non-institutional care services and better for people from within your community? Today, in a district, it's a large district, right? A child from some taluka, some village is coming to a childcare institution in a city. When there are so many children within the city who cannot use the facility that is existing. So can we use that space to start daycare centers? Can we convince childcare institutions to use their spaces to start creches for children? Can we also look at programs like Maharashtra has the Bal Sangopan Yojana? You know, family strengthening with financial support. Believe me, financial support as of today, the families that approach childcare institution, not because protection is an issue. I'm telling you, half the families who come to childcare institutions do not come because protection is an issue. It is because they can't take care. Discipline is an issue for them. Education is an issue for them. Poverty is an issue for them, and childcare and safety is not an issue. Whereas Juvenile Justice Act talks about safety, it talks about protection, and it's created this mechanism so that you can protect and keep children safe, protect them from harm, neglect, abuse, and exploitation. वो छोड़ के बाकी सब चीजों के लिए families childcare institution के लिए CWCs को आते हैं, तो वहां पे हम gatekeeping कर सकते हैं with programs like Bal Sangopan Yojana in Maharashtra. Also sponsorship. Again, don't wait for sponsorship, and let's not be dependent on sponsorship as defined in JJ Act. Today we have, you won't believe it, in just 2 years, we convinced over 7 donors to create sponsorship for children. We said, kuch mat do. Just give us money to support families. They have, you know, we talk about resilience. When you talk of resilience, why do we talk of resilience? Because kahin na kahin hame pata hai, wo hai un families mein. They can manage. They just need that little bit of support. And that little bit of support, whether we like it or no, is that financial support. So can we have this public-private partnership or partnership with CSR to create more sponsorship programs for, you know, and sponsorship program, because ye companies udhar hai, inke community hai ye. No, you're not going to some outside community. So again, when we are talking about gatekeeping, also includes CSR companies with their CSR mandate to protect these children, so that these children once again don't leave their communities and become invisible. And the danger of invisible is when they go out, there is no representation for their children. Aaj nobody is empathetic about a Bangladeshi child who has come to Mumbai. He has no political representation at all. It is only if civil society organizations come forward that we can help them. Then I feel somewhere stakeholders, we forgot to train them in laws related to children. Gatekeeping may, it really helps. Train everybody in the community on JJ Act. We didn't do that. We forgot. Tell them about POCSO, tell them about child, you know, RTE may. Tell them corporal punishment, zero tolerance hai RTE mein. If we want to protect children from harm, we need to tell communities about, we want people to take control of their life without giving them these instruments. And one instrument that we need to give them is knowledge of law, so that they can use it in the best interest of their family, their community, and their children. Similarly, training of all the stakeholders that we've all spelled out on child protection and laws, okay? Next is, I think somewhere we need to, and I think Sandhya also mentioned, some common understanding of who are children in need of care and protection. Time and again, I sit in meetings and meetings and meetings, and I find this different understanding of children in need of care and protection when it is so beautifully spelled out in the Juvenile Justice Act. Many of us are working with children under the juvenile justice system, and I'm sure Vipin will agree with me, but we have never looked at section 2, subsection 14. Never looked at, when we take a child to the child welfare committee, we have not looked at the definition, and that's why the child welfare committee then gets so furious with us. And that's why we have so many children in our childcare institution, because they are not children in need of care and protection. The other thing we forget is a child in need of care and protection is not permanently in need of care and protection. That is something we forget, and that's why children are today, I am going to use the word languishing in childcare institutions. They are not thriving in childcare institutions. The next is principle of practice. I think, tu mujhe pata tha nahi degi 15 minutes. No, you gave me 15 minutes. I think principle of practice is so important. If you're not all going to be on that common understanding of what our principle of practice are and what do they mean. Does individualization mean the same to me, her? Does principle of self-determination mean the same to me? I feel that is also something, and I'm including it in gatekeeping because all stakeholders need to understand that. Yes, my last point, already mentioned, but I'm still going to mention it, reiterate that. Follow-up, review, hand-holding, monitoring, measuring outcomes. Extremely important, including involving right holders, community and duty bearers. Finally, two things. Documentation. I think we should work with our communities on documentation. We don't do that. And all kinds of documentation. How do I approach a CWC with a letter saying, I do not want my child in a childcare institution. I want my child back with me. How do I document and write to the CWC that send my child? There is a provision to send my child on leave. Why aren't you sending my child on leave? I am capable of taking care and keeping my child safe for those 5 days. All kinds of documentation. I think we should train our communities. Last point, we need to have a termination and exit plan. We never include that in our discussion. A termination and exit plan while you are working with an individual child, with the family and with the community. Thank you so much.
Thank you so much, Preeti ji. I think you got your 15 minutes.
I got it, Samrita. I just said it because
No, that's okay. And thank you for giving us such a broad definition of gatekeeping and adding so many things to it. And also, like Sanjay ji, raising some uncomfortable questions and questioning some definitions. But I am not going to talk here anymore. The field is now open for questions. Please, आप लोग अपने सवाल पूछ सकते हैं. Sir, आप बहुत बेचैन हैं बहुत टाइम से. आप
मैं इतना बेचैन ये हूँ कि मैं अपनी सारी outpatient में medical doctor, I'm a pediatrician. I cancelled all my patients and came here. The information of this came on Saturday. So imagine if I'm here because of my passion. I've learned so much from you. I wanted to thank the organizers, Kiran Modi and team, and all the people who are here, that you have done an excellent job. My knowledge is improved. But आपसे एक सवाल मैं पूछना चाहता हूँ, क्या आप डॉक्टर कम्युनिटी से नाराज हैं? आपके इतने बड़े फैमिली टुगेदर इनिशिएटिव ने, you did not invite one doctor. Don't invite me, but invite one pediatrician. You don't need pediatricians to, otherwise why will they come? I've been here. 25 years I worked after my return from the US. We set up the Indian Academy of Pediatrics Child Abuse and Neglect Group. We have about 750 members, ma'am. At least 100 are passionate. Okay. Also, we have set up the India Child Protection Medical Professionals Network, where along with me, 6 mentors have trained 3,000 doctors all over the country and 150 regional experts on child sexual abuse response. Okay, so when you have cases, where the hell will you go? You'll have to go to the doctors as well. The police is poorly trained. Everybody in the systems is poorly trained. Some of us need to understand that if you give some of us, our people, we will also share some of our works over the last 10 years of POCSO Act. These are Supreme Court of India invite us. We go there. The UNICEF invites us. Sole and all, we are just totally friends. We have worked with, if you are from UNICEF, almost everybody in the UNICEF knows me in child protection systems. This handbook was created with 3 expert group consultations. The funding was given by Javier Uguilar. This is a handbook for medical doctors, not at all medical doctors, sir. It is for people all like you. I gave a copy to my think, Sanjay, when I went to his office, okay, this was already sold 15,000 copies in Amazon for about 300 rupees with 10% discount. It has about how you address child abuse, prevention and response in Indian settings as per the Indian laws. We organized the the ISPAN Congress. Vijay Lakshmi, you were there from CRY. I didn't even know that you're now doing such fantastic work. So thank you very much for being. Rita has been there. She comes to our meetings. My question is very simple, very, very simple. The question was for Leher. You know, why you are saying you're failing with the boys after age 8 years? This is a simple question. And if you permit, we have 2 other questions because you have 2 other speakers. Let me just ask them one question for Leher. Why you think this thing is failing, number 1. And other is because, you know, the crucial part is if you want to address prevention, particularly for women and girls against their violence, you have to address boys. Otherwise, nothing is going to happen. Okay, so that's one. And the other is, why have you not talked about children with disabilities? Where are they hiding? They're the most marginalized, the most neglected. They need care. They need care. And therefore, I don't know who's going to address that amongst you. This is second question. The third question and our last question is, why don't you give importance to SBCC, Social Behavioral Change Communication Strategies? Because Indian government doesn't know it. I've just returned presenting my paper at the International SBCC conference, Social Behavioral Change Communication based on the model of socio-ecological model. We have at least 3 papers per year, and effects of religious leaders in child protection, the effects of, all these ANMs and ASHA workers. We work on the ground just like Leher does, but we work just 80 kilometers here at Mewat, which is as backward, it's 112. So I could relate what Leher was talking. Thank you.
Boys older. We should have started with the boys when they were 8, 9, 10 years of age. We started with adolescent boys. And by that age, there is already a lot of economic pressure on them to earn. So they know school is not going to get them very far. They're not concerned with conversations about child labor because they are already engaged in child labor by then. So I think the lesson for us, which is what we are doing in the other states where we are working, is to start with the boys younger. 8, 7, 8. Yeah.
Actually, we've missed out on a lot of children. That's why we kept saying children, so that, you know, with time constraint, we are including all children. We are not leaving out disabled children. As a matter of fact, if we had the time, we would have also spoke about LGBTQ children. These are all children who need, and one thing, let's make a difference. Again, I feel care is different from protection. You know, again, I don't know, somewhere maybe, otherwise I need clarity. So when we are asking questions in alternative care, see, alternative care is lot linked with the juvenile justice system. It's not outside of juvenile justice system. And today, if I have come here prepared, talking about alternative care and strengthening families in the context of juvenile justice system. And juvenile justice system does not leave any children, whether it is children with learning disability, physical disability, children having, anything, children rescued from the sex trade, labor, everybody. It is very, very inclusive in nature. But maybe I didn't understand your question. Okay.
No, I don't have time. We'll have 5 minutes left for lunch. But, please try to understand, children of disabilities and special needs.
I want to comment on that.
Special needs and the government of India, every district early intervention center, every district under the National Health Mission, funding is available, yet they are not reaching where they're supposed to reach the funds. If you don't have centers, Dr. Rajiv Ser or XYZ cannot even take care of children with disabilities. Yes, It's a nice statement by the JJ Act that they will take care of all children, but these special children need special needs, and that needs have to be
And
provided.
I'm telling you, under the JJ system, they are monitoring. So all childcare institutions where there are children with whatever kind of disability, they are mandated, they are required to cater to their
Yeah, but
very
I'm saying
individual
that-
specific needs.
That's within the framework of children in need of care and protection. I hear you. There is a valid point that we don't have enough going on. Like in Madhubani, we work a lot on the disability registration and pension, but I'm sorry, that's all we have to work with. Right? So, yeah, please. Thanks, Agu.
The CM is chairing the meeting, and they are also reporting to the state disability commissioner. So it is convened.
But there is no.
No, their NGOs who are working in the disability sectors are coming.
Workshop that we are having here on alternative.
Yeah.
We all we all are cognizant of the needs of disabled children, and especially in whether it's CPIs or families, we all know that they get neglected and their needs are not taken care of. But going into detail, maybe this is a session for another day. Yeah, we'll move on to other questions. If others have any questions, please. Yeah. In 2 minutes.
I thought India did fabulous work on that since HIV. That's all right. I mean, Vijay can also talk. We did fabulous work. The entire HIV prevention was based on it. And I don't know.
Have
That's what
whole
was my.
sections of SBCC in all organizations. It gets a lot of attention. It gets a lot of focus, I would say. There can always be gaps, but we do, there is a lot of happening on SBCC.
Nothing is enough.
Yeah. So other questions? Yes, ma'am.
Will they be able to open the bank account?
See, again, ma'am, the problem is that when there is a system, so there is a concept of lead bank manager. But once you talk to him or her, they will definitely say we need to comply with the RBI guidelines. So I just wanted to say that systems are there, they are not working in harmony. But definitely if Aadhaar card is updated, because UDI also has this mandate very strictly, there are circulars and sections for making Aadhaar card for underprivileged children. So those circulars we have, I can forward to you. But the thing is that if they work hand in hand, that all problems can be sorted.
Because we get interim compensation for children of POCSO cases.
Yep.
We are not able to get them bank account open. So the interim compensation is not being paid to that child, no?
Yes.
For making of all these documents.
Thank you. Other questions? Other members? Any other questions to the panel? Yes, so thank you so much, everyone. I think I'll hand over to Ian without any further delay. He's going to sum up this panel for us. Thank you so much.
Okay, so I have pages of notes. I've got about 20 minutes of summing up and then we're done. Okay, I did that just to make Kiranji uncomfortable and everyone. Right, exactly. We're on American time. No, okay. So I wanted to thank everybody. These esteemed panelists and our whole day and morning of speakers has been incredibly enlightening and a lot of information in a short amount of time. I'm going to share 4 main points and we're done to go eat. So very quickly, the takeaways from today is number 1, work with an entire family, not a child. Number 1. Number 2, navigate and work with families the whole way along, from the beginning through after placement all the way through. Number 3, community mechanisms are most important. Don't get excited about NGOs and everything else. It's the community that is there forever doing the work to stand up. And number 4, this isn't new stuff. We need to reimagine families and look at a new world with technology, but this is not new stuff. It's basic social work and humanity. And then the last point is that the honorable chairperson, Mr. Anurag, said a beautiful thing during his remarks, that a child can grow easily and successfully with deficiency of resources, but not with deficiency of love. So hopefully we come out of this room with tools that we enact right now And we're really grateful for everybody, and especially the young people for doing the amazing play, and for the single mother and all of the people that were here today representing the true heart of the work. So thank you, everyone.
Thank you.
Thank you, Sangeeta ma'am, for chairing and monitoring the discussion so effectively. May I request Vinita, Case Manager FIT team, to facilitate a token of appreciation to all our panel members.
Thank you so much.
There are boxes outside. Please do remember to get the box.
Thank you so
Thank you to Ian.
So आज के कार्यक्रम के लिए आप सभी का धन्यवाद. So now please join us for lunch and come back on time in an hour. We have a very important panel discussion coming up on child trafficking and alternative care. If someone has skipped registration, so you may register yourself.